their own political to advocate for change. Tobacco control is an issue that requires multi-sector cooperation, and mayors as key decision makers are in the best position to make great advancements in public health policy. Asia Pacific Cities Alliance for Health and Development, was formerly known as Asia Pacific Cities Alliance for Tobacco Control and Non-Communicable Disease Prevention, APCAT, was formed in 2016, starting with 12 cities and doubling to 21 cities in 2017. Today, there are 78 cities and 12 countries in APCAT. APCAT began with a focus on tobacco control. Recognizing regional mayor and subnational leaders alliance is essential to develop stronger political commitments, new partnership opportunities, sustainable and effective utilization of resources, and stronger public health system performance and outcomes. Today, we are proud to have the City of Balanga as one of the forebearers of this commitment in the Philippines. APCAT has also spurred the formation of national alliances in several countries. As you can see on your screen, various commendable efforts were made by our neighboring countries in their pursuit of APCAT's goals, commitments, and programs for a safer and healthier tomorrow for all of us. It's now an honor and privilege to present the City of Balanga's COVID-19 response, routine immunization program, and lessons learned to sustain tobacco control program in our city. Led by our City Health Officer, Dr. Mark Banson, the city started its awareness campaign with available media and conducted consultative meetings with different stakeholders. As early as February 2020, we had conducted capacity building for our healthcare workers, including proper use of PPEs, specimen collection for RT-PCR and antigen tests, and infection control management. Since March 2020, in coordination with the Bataan province, timely surveillance and contact tracing has been initiated to contain the spread and infection in our city and province. Barangay or village health emergency response teams, or BHERTs, were established to assist medical workers in implementing preventive measures in the fight against COVID-19 in our community. The city implemented expanded targeted testing to set forth the detect, isolate, and treat strategies to mitigate, identify, contain, and manage the disease. And together with the province, we established an RT-PCR testing center that returns results in less than 24 hours. Partnership with local health and resorts to accommodate returning overseas Filipinos. And then we set up isolation facilities in our elementary school and one of the resorts also nearby. Improvement and calibration of health emergency management system, or HEMS. This includes fast, free, and quick response patient transport service for COVID cases. Creation and mobilization of the Task Force COVID-19 monitoring team. This team patrols the different areas of the city of Balanga where there's high volume traffic. They remind those who do not adhere to strict health protocols to stay safe. We always wear their masks. Mobilization and creation of disinfection team covers the multiple public health facilities in the city. The city gives daily updates on COVID-19 cases and vaccination schedules, radio and TV stations. As of December 4, 2021, there are currently 12 COVID-19 active cases recorded, which is a big drop from just a few months ago during the height of the Delta variant. Of course, with the looming threat back early in 2020, in 2021, the city was quick to implement COVID-19 vaccination procedures and was able to establish multiple vaccination facilities in our malls and event centers where orderly and comfortable manner of immunization was conducted. So we had 4 main large vaccination sites that are set up so people always know where to go and they are comfortable, and many were willing to go. Another best practice we have is we have a photo booth outside where people are very proud to take their photos showing that they have been boosted, which results in their friends, their family being willing to be vaccinated as well. We also have COVID vaccination for in our barangays or villages, and also in the home for the elderly. As of December 4, we have 135,000 vaccine utilized, which is almost 100% of our target population. Aside from COVID-19 vaccination, we have continued our routine immunization against other vaccine-preventable diseases such as hepatitis B for all citizens, and also all the different vaccinations for children and also for pregnant mothers. Since early on in our journey towards sustainable tobacco-free and smoke-free city, it has not been an easy task. There have been very many roadblocks, including cases filed against the ordinances that our city has instituted. So in May 2018, the Philippine tobacco industry filed a petition against the city in the regional trial court. But we have stood firm in our commitment to pursue proactive programs and to embark on comprehensive reforms because we know that we have been doing well. We already have almost a generation of kids growing up without seeing smoking in the streets, and we want to continue that. So with that in mind, the City Council passed the new Comprehensive Tobacco and Nicotine Regulation Ordinance of 2019. We also seriously aim to increase the life expectancy of our constituents. We want them to achieve life expectancies of 75 years and older. And with this in mind, the City Council passed the first health promotion ordinance in the Philippines. So we use the 20% of our Gender and Development Fund, as well as other sources that are available for our city. We maintain smoking signages. And a really important part of our program, which concentrates on the youth, is our Tobacco-Free Generation program, which advocates our youth to join the tobacco-free generation and not to become part of the replacement smokers. Manila Mayor Isko Moreno appreciated this initiative and scheduled a TFG Manila at Tondo High School in September 2019. Through a strong partnership with the Department of Education, Balang and Bataan, we conducted school health and nutrition caravans in our city. And before the COVID pandemic, to further promote the TFG movement and active lifestyles in Bataan, Balanga City, together with our health promotion board and our second district representative, organized monthly provincial fun runs, which with the grand event, the Grand Provincial Fun Run in December 2019, more than 10,000 smoke-free advocates participated in this event. Continuously, civil society, our universities play a role in planning and implementing our smoke-free policy and health promotion programs. And in a recent move to engage the youth, we have conducted training and workshop in partnership with our Department of Education to do our tobacco control and healthy living training starting from our students at a very young age. We also have our online advocacy campaign, and especially during the World Tobacco Day celebration in 2020 and 2021. We, of course, continue to enforce all our local ordinances with the apprehension of both COVID-19 health protocol violators and also our smoke-free tobacco control violators. And of course, our isolation facilities are smoke-free as well. We ban all tobacco products in our facilities, regular checking of our luggage in our isolation facilities. So with that short summary, I would like to conclude my presentation and invite everyone to watch the videos we have uploaded to our channel. Again, thank you very much to everyone for joining our meeting today, and a pleasant morning to all of you.
Thank you, Mayor Garcia, for sharing the APCAT journey and also the Balanga City experience in maintaining essential health services, tobacco control during this challenging situation. Next, I would like to invite Professor Guy Mas, the President of International Unions Against Tuberculosis and Lung Disease, to provide his opening remarks on lung health for all, solution for a new era.
On behalf of the International Union Against Tuberculosis and Lung Disease, I'm very pleased to welcome you to this 6th APCAT Summit, the Asia-Pacific Summit of Mayors. I particularly wish to acknowledge and thank Budi Gunadi Sadikin, Minister of Health for the Republic of Indonesia, Dr. Bima Arya Sugato, Mayor of Bogor City, Indonesia, and Francis A. Garcia, Mayor of Balanga City, the Philippines, the co-chairs of APCAT. Also, Dr. Guy Phones, Head of WHO's Global Coordination Mechanism for NCDs, Ms. Kelly Larson from Bloomberg Philanthropies, as well as the many other city mayors who are present here today. The Union is committed to a healthier world for all, free of tuberculosis and lung disease. We aim to ensure that no one is left behind, that people are treated equally, and we have a focus on vulnerable and marginalised populations and communities. This summit will discuss the important work that you and your cities can do in combating the many intersecting challenges we face in dealing with communicable diseases such as TB and COVID-19 and non-communicable diseases such as COPD, asthma, lung cancer, and the consequences of tobacco and air pollution. The problems are complex, but the solutions are in your hands. I wish you well for your deliberations today.
Thank you, Professor Denmark, for your remarks. And now I would like to invite Dr. Svetlana Axelrod, the Office of Deputy Director General, Director, Global NCD Platform, Union Interagency Task Force, WHO, to provide his remarks on COVID-19 and NCDs, enabling multi-sectoral and multi-stakeholder response.
Honorable mayors, dear colleagues, it's my pleasure to join you virtually for this very important forum. My name is Dr. Svetlana Axelrod, and I am a director of the World Health Organization Global Non-Communicable Diseases Platform based in Geneva. The WHO Global NCD Platform is a department under the guidance of the WHO Deputy Director General. The department brings together the secretariats of the Global Coordination Mechanism on NCDs and the United Nations Interagency Task Force on the Prevention and Control of NCDs. Through the Global Coordination Mechanism, we engage more than 450 participants, including all WHO member states, UN agencies, funds, and programs, and non-state World Bank, and the regional development banks. The core priority of the Global NCD platform is driving multi-sectoral and multi-stakeholder action for SDG Target 3.4 on NCDs and mental health, and other NCD-related SDGs at global, regional, and country levels. I would like to start by presenting a global perspective on the interplay of COVID-19 and NCDs, outlining the challenges at local and global levels, and then concluding with some feasible solutions. The COVID-19 pandemic has dramatically affected our lives. These last 2 years have been particularly challenging for health systems and economics globally. Disruptions have been seen across all healthcare services, resulting in delayed diagnosis and rapid progression of diseases. WHO conducted several global assessments detailing the initial impact of the COVID-19 pandemic on NCD resources and services. The surveys indicated that over 75% of countries experienced some disruption in NCD-related services. This has been especially difficult for people living with NCDs, as pre-existing chronic conditions made them more vulnerable to becoming severely ill with COVID-19 and having unaffordable outcomes as a result of these comorbidities. Here are a few examples from around the world. In Italy, people who died from COVID-19 in hospitals has had pre-existing conditions such as hypertension and diabetes. In Spain, the patients who were hospitalized due to COVID-19 were discovered to have chronic cardiovascular diseases, which made their condition worse. And we should not forget mental health. One of the most devastating, well-documented consequences that this pandemic has brought about is the worsening of mental health and well-being of people. The experience with COVID-19 and previous pandemics has shown that acting alone, national governments struggle to mobilize sufficient resources and a whole of society response. Complex problems can only be overcome by well-coordinated collective actions through multi-sectoral and multi-stakeholders governance arrangement, with the engagement of a large number of stakeholders representing different perspectives and interests. There is a lot of work that needs to be done at global level as well to link the agendas of COVID-19 and NCDs, so we can help countries
Sustainability, tapi
translate
pada
sound global policies into effective country-level programs. In this context, I would like to highlight several focus areas for future policy and advocacy efforts to ensure that countries better prepare for and respond to the double burden of pandemics and avoid the
Kuat ya.
economic disruption that will follow. Number one, develop a new narrative and combine strategies to address complex health challenges, such as infection diseases outbreak and NCDs. Number two, secure adequate funds. Domestic resources, particularly the funds collected through taxation, are never enough. Some alternative funding mechanisms need to be explored. As an example, at the Global NCD platform, through the UN Interagency Task Force, we have established a multi-partners trust fund to help countries scale up actions on NCDs. Number three, strengthening capacities of ministers of health to work across sectors and stakeholders. To address this, we are designing a training course for NCD managers in collaboration with academic institutions, such as the Johns Hopkins University and other partners. We are also offering regular global meetings to build the capacities of national ministries of health. Number four, engage civil society. Civil society is an extremely important global health partner to address NCDs. The Global NCD platform has a permanent civil society working group for our joint advocacy and policy work at all levels. Number five, establishing multi-sectoral and multi-stakeholder coordination mechanisms. These mechanisms are critical to bring all relevant actors together to achieve common public health goals, while putting essential safeguards in place to manage potential conflict of interest. We have developed a detailed guide through the global coordination mechanism on how to effectively build these types of mechanisms in the countries. Number 6, develop a research agenda. While the COVID-19 pandemic is still a threat, it is also creates an opportune time to start the development of a common research agenda to identify context-specific challenges and solutions. And finally, strengthen the WHO leadership role in a global health governance. WHO has the authority and mandate from its constitution, but we need everyone on board. WHO alone can't address global health problems if governance and non-state actors don't cooperate. I would like to conclude here and thank you for your attention.
Thank you. For all participants, please. Thank you, Dr. Axelrod, for very enticing strategies and move forward for addressing the double burden of disease of NCD pandemic and also COVID-19 pandemic. Next, I would like to invite the last opening remarks from Ms. Kelly Larson from Bloomberg Philanthropies, USA.
Kemarin juga ada lagi yang pernah satu orang.
Hello, my name is Kelly Larson and I work at Bloomberg Philanthropies in New York City. I'd like to thank all of you, honorable ministers, governors, mayors, city officials, for your work on tobacco control and non-communicable diseases and for participating in this 6th summit for mayors in the Asia Pacific region. Tobacco control is an issue that requires multi-sectoral cooperation, and as mayors, you play a critical role in advancing tobacco control in your cities. At Bloomberg Philanthropies, we have supported tobacco control since 2007, committing more than $1 billion in working with over 100 countries to reduce tobacco prevalence and thereby saving lives. Tobacco is a leading common risk factor for non-communicable diseases, and we know that NCDs account for 7 out of 10 deaths globally. 70% of all deaths are from non-communicable diseases. We at Bloomberg Philanthropies believe in the power of cities and are supporting cities around the world to implement those proven best practice interventions that we know save lives. We fully support Empower policies, including smoke-free public places, warning people of the harms of tobacco use, enforcing tobacco advertising, promotion, and sponsorship bans, increasing tax on tobacco products, and also implementing mass media campaigns that warn of the harms of tobacco use. The Mayors Alliance has made great strides in promoting tobacco control throughout the Asia Pacific region. It started just in 2011 with 12 cities in Indonesia and has since expanded to more than 300 districts and cities throughout Indonesia. We're delighted to know that 12 additional countries have joined the alliance, and we see it as a critical platform for sharing best practices and lessons learned amongst leaders like yourselves. We appreciate how difficult the last 2 years has been during the COVID-19 pandemic and appreciate your commitment to your pandemic response, but also to continuing to support tobacco control efforts. So wishing you all the best in this important summit and hope to see you soon.
Thank you, Ms. Larson, for highlighting the critical roles of mayors to create the cities and also the importance of tobacco control for people's health. Now we would like to share the speech from Mr. Anies Baswedan, the Governor of DKI Jakarta, who talked about the Jakarta Smoke-Free Initiative.
Assalamualaikum warahmatullahi wabarakatuh. Perokok memiliki risiko lebih besar untuk mengalami gejala yang parah, bahkan menyebabkan kematian apabila terpapar COVID-19. Dan berdasarkan survei Sosial Ekonomi Nasional pada bulan Maret 2019, 26% dari warga DKI adalah perokok dan menghabiskan lebih dari 10 batang rokok per hari. Hal ini juga agak mengkhawatirkan adalah data riset kesehatan dasar Riskesdas pada tahun 2018 lalu memberikan data bahwa prevalensi perokok anak dan remaja usia 10-18 tahun meningkat hingga 9,1%.
Pemerintah Provinsi DKI Jakarta telah menetapkan kebijakan dan peraturan untuk melindungi masyarakat dari bahaya merokok. Kawasan tanpa rokok telah diberlakukan di seluruh tempat umum, tempat kerja, sarana pendidikan, tempat anak bermain, tempat ibadah, fasilitas olahraga, dan fasilitas kesehatan. Sosialisasi bahaya merokok dilakukan di sekolah-sekolah, di tempat pelayanan kesehatan, dan di tempat umum.
Kenapa sih gak boleh merokok? Satu, merokok itu berbahaya bagi kesehatan. Bisa menyebabkan terutama yang paling fatal itu kematian. Terus yang kedua, berbahaya juga buat orang sekitar. Karena yang merokok kita, tapi bisa juga dampaknya ke orang lain.
Penyebaran informasi tentang bahaya merokok dan penyampaian peraturan pengendalian tembakau di DKI Jakarta dilakukan melalui media sosial untuk meningkatkan kesadaran masyarakat. Di samping itu, masyarakat dapat melaporkan pelanggaran yang ditemui melalui aplikasi Jaki. Pemerintah DKI telah melarang iklan rokok pada media dalam dan luar ruangan, serta melarang display produk rokok pada tempat penjualan untuk melindungi anak dan remaja agar tidak menjadi perokok pemula. Warga DKI melakukan berbagai inisiatif untuk menciptakan lingkungan yang sehat dan bebas asap rokok, seperti yang dicontohkan Kampung Bebas Asap Rokok RW 6, Kelurahan Kayu Manis, Kecamatan Matraman. Pemerintah DKI mengapresiasi dan mendukung sepenuhnya inisiatif tersebut. Pemerintah DKI pun memberikan layanan upaya berhenti merokok di puskesmas-puskesmas yang memiliki klinik upaya berhenti merokok. Saat ini, lebih dari 11 juta orang di DKI Jakarta telah mendapatkan vaksin COVID-19. Testing, tracing, dan treatment terus dilakukan. Pandemi COVID-19 menuntut kita untuk mampu bergerak cepat dan melakukan berbagai inovasi, termasuk integrasi program pengendalian tembakau dengan penanganan COVID-19. Strategi pemerintah DKI ini dilakukan untuk memastikan semua program kesehatan berjalan dengan efektif.
Mari kita selamatkan keluarga terdekat kita, terus sahabat yang kita hormati, kita sayangi, masyarakat dari bahaya dampak rokok. Mari kita buat perubahan untuk negeri kita tercinta. Insya Allah semuanya bisa sehat, semuanya bisa menjadi pribadi yang menjaga sesama. Terima kasih. Assalamualaikum warahmatullahi wabarakatuh.
Thank you so much. So from that video, we can learn about governor leadership in tobacco control and public health programs, which should inspire us all, and let's follow on his remarks. Now, I think this is the most important part of the opening session. We would like to invite the opening and keynote address from Minister of Health, Republic of Indonesia, Mr. Budi Gunadi Sadikin, who will talk about shared responsibilities in preventing pandemics. Mr. Minister.
Dr. Bima Arya, distinguished mayors, ladies and gentlemen. Throughout the pandemic, the cigarette consumption among the low socioeconomic society tend to increase. This is unacceptable. Not only that smoking exacerbates the impact of COVID-19 transmission, but it is also a serious threat to the human resources development. Despite setbacks the pandemic imposes, Indonesia is committed to reduce youth smoking prevalence from 9.1% in 2018 to 8.7% in 2024. In doing so, we devised these following 4 strategies. First, smoking cessation strategies. We provide free consultations to support smokers who are willing to quit smoking by through free sessions of over phone call and services in health centers. Second, education, communication, and information strategies. We devise massive communication, information, and education to the community using social media and other effective above-the-line communication channel. Third, decentralized policy advocacy strategies. We advocate the local government to issue regulation regarding free smoking area and to impose free smoking area in designated locations at district and municipality level. Fourth, centralized policy advocacy strategies. We advocated to the Ministry of Finance the issuance of a regulation imposing the highest attainable tax for cigarette excise tax. We also developed regulations that will stipulate pictorial health warning to cover 90% of the surface packaging area, to forbid the selling of the sold cigarette sticks, and to regulate the heated tobacco product, as well to forbid cigarette promotions in electronic media and public spaces. Ladies and gentlemen, as the COVID-19 is continuing to spread around the world, with more than 5 million deaths across almost 200 countries, tobacco smoking may not be our only threat to focus on today. In fact, the COVID-19 have made us reallocate funding, resources, and logistics to manage the pandemic. In itself, I am very grateful that as a health minister, I gain support from other ministries and other stakeholders that make sure we devise the right strategies to contain the transmissions in Indonesia. And as of November, Indonesia is both grateful and proud to be able to keep our 2021 vaccination target on track. I hope so is with many other countries. Ladies and gentlemen, the pandemic has taught us one very important lesson, that only with strong and effective collaborations we can achieve whatever we set to achieve. Finally, with the forces of 78 city mayors representing 12 countries, I am optimistic that the 6th Asia-Pacific Cities Alliance Summit for Health and Development will be our critical milestone to bring real health solutions that we all want to see and our people deserve. Thank you.
Thank you, Honorable Minister, for providing the opening and keynote remarks for today's summit. And we mentioned a strong commitment to reduce youth smoking prevalence and also to ban cigarette promotion, which all of us know very important for controlling the tobacco control use, and also how to tackle this situation with strong and effective collaboration. And now I would like to invite Mayor of Bogor City, Indonesia, also the APCAT co-chair, Dr. Bima Arya Sugiarto, to share the importance of leadership, accountability, and management of tobacco control and vaccination. Mr. Mayor, the time is
tempat kita mengadu dan kerjasama dari kesehatan warga.
hello. Mr. Bima Arya. Apologize, please. I will check if he is on in the. I think while we wait for Mr. Bima Arya to join all of us, so we would like to present you the video from tobacco farmer children who share their voices about tobacco use and tobacco farming.
Selama orang tua saya bertani tembakau, kondisi
As long as my
perekonomiannya
parents farmed
pas-pasan.
tobacco, their economic condition was mediocre. The gain is little and the loss is a lot.
Dulu orang tua saya menanam tembakau
My
dan
parents used to grow
sekarang menanam
tobacco
lupis.
and now
Dulu
they
pas
grow
menanam
lupis.
tembakau, orang
When
tua
my
saya
parents grew tobacco, it
sering
was
kesulitan
difficult
saat menerima
to
uang.
receive money.
Agak jelek sih.
It's
Maksudnya
a bit
malah rugi.
poor. I mean, it's a loss.
Kayak kasihan, soalnya saat
I feel sorry
pas panen agak
because when
kurang
my
hasilnya.
parents growing tobacco,
Kadang
the harvest
ada yang
was
tidak
less.
laku.
Sometimes
Kadang
those
ada
are
yang laku.
unsold and some are sold, more
Kadang banyak
sold or
yang
not, more unsold.
Yo kadang yo
Sometimes
kurang, kadang
it's
yo
not
cukup,
enough,
mung
but
sekedar cukup.
sometimes it's just enough.
Yang saya rasakan
I
3 tahun
feel what I
belakangan
feel
ini,
this past 3 years.
harga tembakau kurang baik
Tobacco prices
dan
are
cuaca
not
juga
good and the
kurang
weather
bagus.
is not
Jadi
good as
banyak
well.
ruginya.
So we suffer
Harapannya
losses a lot.
Bapak
So
Ibu untuk
my hope is my parents
menanam tanaman lain
can
atau belajar
learn to grow
menanam
other
tanaman lain
plants
biar efektif dan efisien.
that
Kesulitannya
are more
pada saat
effective and efficient.
itu
The difficulty
memberikan
is
tembakau itu
when
uangnya
we
tidak
sell
langsung
tobacco,
diberikan
the money is
kepada
not directly
orang tua
given
saya.
to my
Meskipun
parents.
orang tua
Even though my
saya
parents
petani
are
tembakau,
tobacco
saya tidak
farmers,
merokok
I don't
karena
smoke
merokok tidak
because
bermanfaat
smoking
dan
is
ingin
not
hidup
useful
sehat.
and
Dan
I want to
harapan
live
saya
healthy.
pada orang tua
And my hope
untuk menanam
for my
tanaman
parents
selain
is to
tembakau
plant
yang
crops
lebih
other than
bermanfaat
tobacco
bagi
that
Yo
are
harapannya
more
Bapak
useful.
Ibuku iso
I hope that my
nandur
mother and father
seluwih nguntungke
can
saliyane Mbak.
grow
Walaupun
crops other than
bapak
tobacco.
saya petani
Even though my
tembakau,
father
tapi
is a
saya
tobacco farmer,
tidak
but I
pernah
never
merokok
smoke
biar tubuh saya
so that
sehat.
my body is
Tidak
healthy.
merokok.
I try
Saya
not
tidak
to
merokok.
smoke.
Rokok
I
bisa
don't smoke.
merusak
Smoking can
kesehatan
damage
paru-paru.
lung health. We are the children of tobacco farmers from Wonolelo, Sawangan, Magelang Regency. We wouldn't smoke, even though our parents grow tobacco, but we want to be a healthy and smart generation.
There are the stories from tobacco farmers' children that their expectation that their parents will switch to alternative crops and also their commitment for being tobacco free. So I think this should be one important take from us. And I think Bapak Bima is now already joining with us. So I would like to invite Dr. Bima Arya Sugiarto, Mayor of Bogor City, Indonesia, and the co-chair of APCAT to share the importance of leadership, accountability, and management of tobacco control and vaccination. Mr. Mayor, the time is yours.
Okay, thank you for the opportunity to share our experience in the city of Bogor during the pandemic COVID-19 era. Excuse me, can you hear me?
Yes, we can hear you, sir.
Yes.
It's clear, Pak.
Okay. Today, it is very important to note that we have been controlling the situation in terms of COVID-19 in the city of Bogor. Now, the situation is much better compared to a few months ago, particularly during June and July. That was the worst situation in the city of Bogor. On a daily, there were around 700 positive cases, confirmed cases in our city. And on a daily basis, there were around 10 to 20 confirmed death casualties in the city of Bogor. And at that time, we also faced problems related to the availability of oxygen and also medicine. But now, I am very proud to say that the situation is relatively under control at the moment. But it is also important to note that vaccinations is the major issue related to the success of controlling COVID-19. Today, the vaccination achievement rate is 89.05%. It is among the highest rate in the province of West Java. And our major strategy in implementing the vaccination strategy is spreading the vaccination center, large centers, and also vaccination at the regions, as many as possible, in not only in health facilities, but also in mall, shopping centers, education institutions, and so on and so forth. And we have been involving a number of institutions such as Indonesian Army, police, mass organization, young and activist organizations, companies, and so on and so forth. And we are among one of the best system in West Java in dealing with vaccine. And we also apply the Peduli Lindungi applications. So it is a must for every citizen in the city of Bogor when they enter the public spaces, and also for traveling to use a scan QR code in Peduli Lindungi. We also, and in terms of tobacco control, I emphasize the importance of tobacco prevention campaign during the pandemic. I instructed the hospital in Bogor to identify in relating the number of positive cases with the tendency of tobacco consumptions among the patients. it is our major assumption that tobacco consumption can cause comorbid disease, will tend to cause COVID-19 severe symptoms. So most of the confirmed COVID-19 cases have been actually those who have comorbid disease, lung disease, and also the habit of smoking. So I emphasize the right momentum for campaigning the tobacco control during the pandemic, because those who have suffered disease have been identified as heavy smokers as well. And we also integrating the COVID-19 health protocol with the smoke-free. We encourage to use masks properly, hand washing with soap and running water, physical distancing, reducing mobility, avoid crowds, getting vaccinated, and also for stop smoking. So the health protocol campaign during the pandemic has been the right momentum for accelerating the stop smoking campaign. So it is very timely for us actually for adding the stop smoking campaign during the health protocol issues in this pandemic era. We have strong regulations for doing this campaign. The regulations number 10, 2018, regulation number 12, 2009 for smoke-free area in state of Bogor, and also other major regulation related to tobacco control. And during this pandemic, I've been also doing the inspection for ensuring the smoke-free enforcement during this COVID-19 pandemic. So a few times I instructed the task force to do the inspections, ensuring that our local regulation is strongly implemented. Smoke-free sudden inspection to all public places, and smoke-free sudden inspections in public transportation, for example. And also we ensure that there is no tobacco display in mini market and also mini shops throughout the city. We do the tobacco display ban sudden inspection at point of sale. And in this issue, I noticed that there have been a changes strategy from tobacco or cigarette industries in doing the campaign for their products. It doesn't necessarily in the form of cigarettes or box of cigarettes, but it can be found in other forms. For example, a cup of tea, another pictures who are not really related to cigarettes. So I think it is very important for us to observe this kind of situation when the cigarette producers have been changed their strategy in doing these promotions. And a few days ago, we also destroying a number of illegal advertisement tools throughout the city. Smoke-free signage distributions, for example, and we also doing the mobile court or tindak pidana ringan, and we also ensure that the counseling is in place, the quit smoking counseling through mobile health counseling. We have mobile health counseling in the city of Bogor who is serving the people when they need to consult to quit smoking. And overall, I think Bogor City government is really committed on smoke-free implementation and firmly ban taps in all Bogor City area, as it is really influence children and teenagers to try smoking and harmful for their health. And I think our consistency, our persistence is really needed to increase our leverage in dealing with this tobacco control. And it is also important to focus on younger generation for preventing them to be influenced by all advertisement. I think saving younger generation is our passion in the issue of tobacco control. That would be my presentation. Thank you very much.
Thank you very much, Dr. Bima Arya, for your inspiring remark. And we can see that city of Bogor is certainly one of the leading city in Indonesia for tobacco control and also for other measures. Thank you for showing such a great leadership and commitment.
Thank you.
Thank you. And now I would like to invite both of the APCAT co-chairs, Dr. Bima Arya Sugiarto and also Mayor Francis Agarska, to present the declaration of the Asia Pacific Summit of Mayors 2021. To both Dr. Bima Arya and Mayor Garcia, the time.
Okay. Mayor Francis.
Yes.
Will you go first? Or?
Whatever your preference is, whether first or you can go first, and then I'll just
okay.
Second half.
Okay, Mayor Francis, thank you, ladies and gentlemen. I will read the declaration. Okay. Okay. We, the delegates of the 6th APCAT, the Asia Pacific Summit of Mayors, recognize how the COVID-19 pandemic continues to remain a global public health emergency. The COVID-19 response have severely jeopardized health and development programs of several nations in the region, forcing countries to undo and fritter away the gains they were making earlier towards achieving the United Nations Sustainable Development Goals and targets. For instance, the alarming drop in routine immunizations of children in several nations due to COVID-19 has increased the risk of vaccine-preventable illness. This year in 2021, the inequitable and uneven rollout of vaccines against COVID-19 has made us even more vulnerable because of the heightened risk of serious outcomes and deaths among those vaccinated, especially tobacco users or those with tobacco-related comorbidities. Also, the risk of more mutation as the virus circulates in our populations is looming threat. Health and social security are the central cog in the wheel to accelerate progress towards all goals and targets of the SDGs. More scientific evidence is emerging to show that those most at risk of dying or becoming severely ill from COVID-19 are those with pre-existing non-communicable disease. Tobacco is leading common risk factor for major NCDs, accounting for over 70% of untimely deaths globally. And it also increases the risk of communicable disease, including tuberculosis or TB. We recognize that APCAT is a vital platform to share experiences, shape local actions, and secure gather leadership, as well as looking for synergistic action between specific health and development programs. I allow Mayor Francis to continue the declarations.
Okay, thank you very much, Dr. Mayor Bima. We commit to accelerating progress towards eventually ending tobacco use, as well as preventing the avoidable burden of NCDs, eliminating TB and viral hepatitis, and improving synergy between health and development programs, and promoting integrated responses where possible, and thereby averting untimely deaths by, number 1, sustaining effective implementation of tobacco control programs that include smoke-free environments, a complete ban of tobacco advertising, promotion, and sponsorship, promotion of larger graphic health warnings with plain packaging on tobacco packs, smoking cessation programs, and a ban on electronic cigarettes, heated tobacco products, shisha, and similar products. Number two, ensuring that NCD prevention and treatment services are not only sustained but scaled up with their inclusion in COVID-19 responses as part of health security, acknowledging the links between underlying chronic conditions and COVID-19 complications. Number three, continuing scale up of the delivery of routine care, supplies of essential medicines and technologies, screening and diagnosis, access to resources, and supportive services for ongoing management of TB and other lung diseases. Number four, preventing interferences and rejecting funding, logistics, donations or grants from and partnerships with any entity related to any unhealthy commodity industry, such as but not limited to tobacco, alcohol, sugary, and sweetened beverages. Number five, working with national governments and policymakers to raise taxes and prices on unhealthy commodities, such as but not limited to tobacco products, alcohol, sugary, and sweetened beverages. Number six, leveraging every possibility of partnership and integrated health and development responses so as to advance progress on scaling up COVID-19 vaccination, routine immunization, adult vaccination for vaccine-preventable illnesses, among others. Number seven, addressing the challenge of viral hepatitis as a major public health threat in the Asia-Pacific region through elimination of mother-to-child transmission by raising public awareness and strengthening health systems through public and private partnerships. Number eight, adhering to public health and scientific expertise for effective prevention and management of COVID-19, and rebuilding our cities in a way that improves the public health system through One Health and Partnership for Healthy Cities approach. We commit to doing everything to harness the power of our city governments to ensure that tobacco control, NCD prevention, TB control, elimination of viral hepatitis, routine immunization, and scaling up COVID-19 vaccination are effectively implemented and measured, along with other health and development initiatives, and the recovery from COVID-19 is healthy, equitable, and sustainable.
Thank you, Mayor Francis.
Thanks, Dr. B.
Thank you so much, both co-chair of APCAT for presenting the APCAT Summit Declaration, and it could be, it may become a shared commitment from all cities to improve public health and tobacco control in the future. With the presentation of the 2021 Asia Pacific Summit of Mayors Declaration by the APCAT co-chairs, that is the end of our wonderful opening session. And please don't forget to post the highlights from the speakers today on your social media channel with hashtag APCAT 2021. Again, thank you, Mr. Mayor Garcia and also Mr. Bima Arya.
Thank you.
Dear ladies and gentlemen, mayors and leaders, now we shall move to our second session on mayors' accountability in advancing tobacco control program, unhealthy commodity industries, and partnership with the community. In this session, we will hear more sharing from our leaders throughout Asia Pacific. And this session will be moderated by one of our APCAT media person, Ms. Rita Widyadana. To Ms. Rita, I handed this session to you.
Many thanks, Dr. Ayu. Thank you very much for your lovely introduction. Good afternoon, good morning, good afternoon, ladies and gentlemen. Welcome to the session second of the 6th APCAT Summit of Mayors 2021. As mentioned before, I'm Rita Widyadana as a moderator for this session. I would like to warmly welcome honorable presenters, panelists to this session. Dr. Gan Kwan, Directors of Tobacco Control of the Madam Ramia Kancharla from Vital Strategies, Bapak Inyoman Suwirta, Region of Kelungkung, Bali, Indonesia, Mr. Keo Sok Pisay, Vice Governor of Phnom Penh City of Cambodia, Madam Reno Dahal, Mayor of Bharatpur City, Nepal, Datuk Sri Mahadi bin Chengah, Mayor of Kuala Lumpur, Malaysia, who will be represented by Mr. Anwar Muhammad Zain, who is Executive Director of Socio-Economic Development of Kuala Lumpur City, Madam Dr. Randa Guillermina Filomena Saldana, Mayor of Dili City, Timor-Leste, Mr. Golam Kabir, Mayor of Damrai, Upazila, Dhaka District, Bangladesh, Madam Rafika Akhtar Janbabi, Mayor of Saidpur, Rangpur District, Bangladesh, Mr. Gaurav Gupta, Chief Commissioners of Bruhat Bengaluru Metropolitan, Karnataka, India. This session will explore the mayor's accountability in advancing the effectiveness.
I'm sorry, Miss Rita, you're muted.
Sorry, I repeat. This session will explore the mayor accountability in advancing effectiveness of tobacco control program, preventing undue influence of unhealthy commodity industry, and ensuring a greater partnership with community in implementation and monitoring the program performance. This session will also recognize the mayor leadership to identify opportunities and possibility in all situations. But before we hear what our leaders would say, I will invite Dr. Gan Kwan, Director of Tobacco Control of the Union, to present his speech on the importance of tobacco control in preventing pandemic. He will be followed by speech by Madam Ramya Kancharla from Vital Strategies on Partnership for Healthy Cities. Over to you, Dr. Gan.
Good morning, everyone. My name is Gan Quan. I'm the Director of Tobacco Control at the International Union Against Tuberculosis and Lung Disease. It is a pleasure to be invited to speak at the 6th APCAT. I wish everyone good health and safety during this difficult time. The pandemic presented unprecedented challenges to almost every aspect of our life. It is particularly the case when it comes to public health and tobacco control. Because political attention has been shifted to pandemic control, and rightly so, tobacco control work has been deprioritized on the government agenda. But there are still opportunities for tobacco control during the pandemic. We know from scientific research that smokers are more likely to get seriously sick from COVID-19 than non-smokers. We need to leverage this evidence through public campaigns to encourage smokers to quit, like what the UK did in the early months of the pandemic. Because of the lockdown implemented by most countries, there's also more space for online cessation services to be useful. Last year on World No Tobacco Day, WHO launched an online cessation platform with the aim of helping 100 million people to quit tobacco use. Countries should make use of this resource to complement and strengthen their existing cessation services. Enforcement of tobacco control policies has definitely been a challenge during the pandemic. In-person inspections were not possible for a long time because of infection concerns. Wherever and whenever it was deemed safe for inspections to resume, there is an opportunity to integrate tobacco control into sanitation inspections, as what was done in Depok and Yogyakarta in Indonesia. Inspectors in these two cities were trained and were made aware of the link between COVID and tobacco use. During inspections for COVID sanitation, they checked to make sure that no one was smoking indoors according to the law. I felt truly heartened by how many of our colleagues took advantage of the opportunity offered by the new technology to organize capacity building webinars, conferences, and meetings, sometimes with the attendance of over 1,000, something we were never able to do in person before the pandemic. Despite the Zoom fatigue, we are now all aware of the cost effectiveness of online meetings. I'm sure at least a mixed format of training and conference will continue into the future. Countries should continue and expedite the adoption of FCTC and Empower policies. Not only smokers get more sick from COVID, a healthier population with reduced smoking is also better prepared in time of the pandemic. The best way to reduce smoking is to raise tax and to make cigarettes less affordable. The additional revenue generated through tax raise can be a valuable source of income for governments to support pandemic recovery. As we know, all governments face a budgetary shortfall from the pandemic, and economic recovery is the top priority of the government agenda. This is what Russia did. They raised the exact tax of tobacco products and e-cigarettes by 20% to fund pandemic recovery. The pandemic presented as an opportunity for the tobacco industry to intensify their corporate social responsibility campaign and to build relationship with the governments. We've seen many examples of donations to the region by the tobacco industry, such as hospital beds, ventilators, and masks. We've also seen a couple of tobacco companies investing in vaccine research and development. While not surprisingly, the effort didn't really lead anywhere and was more a publicity stunt, it helped improve the public image of tobacco companies. Such CSR activities by the tobacco companies have been widely condemned by NGOs. Countries need to incorporate into their domestic laws Article 5.3 of the FCTC, which forbids influence of tobacco industry over tobacco control policy making. Indeed, the pandemic has posed unprecedented challenges for tobacco control. There still exist opportunities and best practices. It looks increasingly likely that we may have to continue the way of life from the last 2 years into the near future. I would encourage countries and cities to learn from these best practices and continue to control tobacco use during the pandemic. It is not just a win for tobacco control, but also for NCD control, pandemic response, and the fiscal health of the government. I will finish my talk here and wish everyone a successful conference. Thank you.
Many thanks, Dr. Gang. It is very important to note that despite all pandemic control, we still have to expedite tobacco control and also prevent tobacco industry from interfering our life, like providing CSR and investing in vaccine. So this is important also for all countries to learn the best practice during the pandemic on how to sustain tobacco control. Thank you. I will invite Madam Ramya Kanchara from Vital Strategies, who will present her speech on partnership for healthy cities. Over to you, Madam.
Hello, good morning and good afternoon. My name is Ramya Kancharla and I represent the Partnership for Healthy Cities, a global network of 70 cities committed to preventing injuries and non-communicable diseases. The partnership is supported by Bloomberg Philanthropies, led by Michael Bloomberg, former New York City mayor and current World Health Organization ambassador for non-communicable diseases. On behalf of Vital Strategies, the partnership's implementing partner, I would like to thank APCAT organizers for inviting me to speak today at the Asia Pacific Summit of Mayors and for this body's powerful dedication to ending the tobacco scourge and fighting NCDs. For more than 4 years now, We at the partnership have worked closely on tobacco control with Bangalore, Bandung, Jakarta, and Kuala Lumpur. And it is with their challenges and successes in mind that I speak to you today. As you know, NCDs are a silent pandemic. Combined with injuries, NCDs, including cancer, diabetes, heart disease, and chronic lung disease, cause an estimated 80% of deaths across the globe each year. It cannot be stressed enough that these deaths are largely preventable. Almost 46 million people worldwide, men, women, children, grandparents, are killed each year by social and environmental determinants of health. It is without a doubt that there is a connection between tobacco use and NCDs, as is the connection between smoking and serious COVID-19 illness. But actual policy making and implementation is an uphill battle. Cities are making significant strides, however. In Bandung, for instance, new regulation bans smoking in health facilities, schools, places of worship, and public transportation. And a mobile app allows the public to record smoke-free violations. The cities in the partnership's global network are using a combination of policy making, enforcement, and communications campaigns to move toward a smoke-free future that is also free of industry interference. Cities are engines of change. They can move quickly to implement life-changing policies that affect great numbers of people. And with the majority of the world's population now living in urban settings, cities are uniquely positioned to transform the fight against NCDs. On behalf of the partnership, it is my pleasure to congratulate the leaders that are present here for the tobacco control achievements that they have accomplished so far to improve their respective cities. We look forward to continuing our collaboration. Thank you.
Thank you, Madam, for your insight that city are engine change maker and has an important position to fight against communicable disease and other health issue. Many thanks. And I think today, now we will move to what our leader have say about their program. So this is very important for us to hear directly from them. For that, I will ask all the panelists one similar question for round one to be answered by all panelists in brief. And the second round, I will also ask all panelists one very brief questions, and all panelists are expected to answer briefly for each question. And I would like to humbly panel to stay at the panel until the Q&A session. Many thanks. My first question for all panelists: what are the key success you made in tobacco control, such as smoke-free implementation, ban to tobacco advertising and sponsorship in your city while responding to COVID-19? And how would you see your leadership role in finding local solutions and opportunities to improve control of tobacco smoking, non-communicable disease or NCD in your city? We may start with Bapak Inyoman Suwirta, Regions of Klungkung, Bali, Indonesia. The time is yours, Pak Suwirta. Is Pak Suwirta present?
Baik, saya kemarin udah ada video ya.
Yeah, I already sent a video.
The video is for the
Yeah, just brief question, answer, Pak. Jawaban singkat saja.
Ya, baik. Jadi
Yes,
pertama,
okay. So first, regarding the tobacco control in Klungkung Regency. So since we have the regional regulations of 2014 in Klungkung, Since 2016, we already expedite the implementation where the commitment of the regional government is strengthened, that we are very sure we ensure everyone that tobacco is harmful to our lives, so that first we strengthen the health lifestyle related to pandemic, and then we collaborate with multi-sectoral by engaging elements of communities and teenagers. And we also prevent all types of advertisements. So it's interesting in Klung Klung, including sponsorship and advertisements indoors and outdoors, all are banned. So when you go to Bali, one of the districts with no tobacco advertisements, it would be Klung Klung. And I also see the potential of resources at the regional level with a local content. So the key of success is the strength or the local content that we prioritize to reach out the community so that they understand the important meaning of a non-smoking area. And we also encourage the people so that they participate always in enforcing non-smoking area and to implement a healthy lifestyle. As for the strengthening of regulation related to local content, we in Bali, especially in Klung Klung, all regulations that we made regarding non-smoking area, including waste and drugs, we included in the traditional regulations, because tradition is strong in Bali compared to the government regulations. We call it Dreste, which is regulations regulating the habits of the people. So by regulating themselves using traditional ways, the non-smoking areas will be more strengthened. And we also engage business persons where we have supermarkets. We tighten the regulations when they're selling cigarettes. They are not showing the cigarettes, but it's covered. And we also strengthen the cessation as clinics, and we prepare young cadres and teenagers. It's anti-smoking teenagers. So with non-smoking areas, it relies on continuous commitment of the local government. So from the beginning, when we made the local regulations, we always strengthened it. And during the advertisement control, we encountered challenges, but we do it consistently so that we can have it implemented safely. So it's proven from the data and surveys where in Indonesia, the compliance of Klung Klung people for not smoking, it's at 85%, and the availability of ashtray is quite low, as well as the smoking odor, Klung Klung is the lowest. So it proves that our communication with the community is connected. So with this non-smoking area in Klung Klung, we don't find any serious problems. We just have to maintain our consistency, and we have to help the smokers. So to avoid them from being left out. So as the region of Klung Klung, I'm highly committed to maintain and strengthen these non-smoking areas for a more healthier generations, especially during the pandemic. We strengthened it more, and other things or other places that is possible for smoking, we already regulated, including cafes, centers of tobacco and drugs and liquors. We closed them down. So we have zero tolerance so that we can strengthen this non-smoking area policy. So that would be all from me. Thank you. Pak Suwirta,
Will you take to improve in tobacco control in 2022? NCDs and COVID response in your city.
Translate ya.
Halo Pak.
Ya.
Bagaimana? What is your action next year? One action to improve your tobacco control and COVID response and NCD.
Ya, untuk aksi di tahun
yes, for the PTM NCD in 2022, we are going to strengthen the regulations with local content basis. It's in a small number that we have done so far. We have the existing regulations, but it's not properly implemented yet. So we will strengthen it more, the implementation in 2022. Yes, thank you very much. Pak Suwirta.
Mr. Keo Sok, Phnom Penh City, Cambodia. What is Do we have Mr. Keo?
Yes, Mrs. Rita, do you hear me?
Yes, sure. Sorry. Yeah, the question is same, so you can directly answer. I'm sorry, you are Madam. The question is the same, so to save time, you just answer them directly. Thank you so much.
Thank you, Mrs. Rita. Good morning, and Excellency, ladies and gentlemen. It is my great honor to participate in the 6th APCAT Asia Pacific Summit of Mayors. Allow me to express my sincere appreciation for your arrangement made for this summit. Like many other countries in the world, Cambodia has been severely affected by the current COVID-19 pandemic, socially and economically. Even so, our government has fought consistently and hard to protect the life and the livelihoods of people in achieving high
ini lingkungan hidup.
with 88
menghindari pencemaran udara.
With 88.61% of 16 million populations fully vaccinated as of the 6th December 2021. Phnom Penh citizens fully vaccinated first and second dose, and above 90% of them have completed the boosting dose. This pandemic has evidently shown how vulnerabilities a health system can have serve implications for the delivery of essential health services. This transition from the current pandemics to endemics in the future is possible, but would require a long and collective effort nationally, regionally, and globally to ensure that the world will be safe again. In regards, by responding to COVID-19, Phnom Penh Capital Administration, especially Phnom Penh's Health Department, made progress in smoke-free implementations and ban of tobacco advertising and sponsorship. First, we established Phnom Penh Capital City Subcommittee on Tobacco Control, which consists relevant key players from technical departments and governor of all the 14 districts of Phnom Penh. And this will have engaged all key players in implementing tobacco control, as well as work closely with non-government organizations named Cambodia Movement for Health in monitoring violations against tobacco control regulations by the tobacco industry, as we also cooperate in counter those violations. Moreover, we constantly carry out training, workshops, and meetings with our local key players and citizens to promote the tobacco control regulation. Even during this pandemic, our local key players have constantly promoted in order to raise awareness of the dangerous health effects of tobacco usage at small shops, restaurants, schools, pagodas, gas stations, marts, and along the street. And we have also put up the non-smoking signs at many indoor places around Phnom Penh. Most importantly, we have committed to implement the policy of our National Committee of Tobacco Control and the National Committee Combating COVID-19 as our role in a sub-national level was fully committed to prevent, control, and manage the COVID-19 outbreak. Last but not the least, I hope that our effort will bring fruitful outcome, ensure society with healthy environment for us and our children. And for the second question, the ones and important action in the version of Phnom Penh to implement in year 2022 is to improve tobacco control and non-communicable disease. Besides from promoting the smoke-free implementation, Phnom Penh will improve for public participation. We have initiated and raised awareness to reduce the consumption of overly sweetened foods and beverage. These initiations affirms the strong commitment of the Phnom Penh Capital Administration Active Partnership for the Global Network for City Welfare. Striving to reduce NCDs, the partnership was formed in May 2017 and led by the World Health Organization. PPCA will work to implement partnerships with vital strategies to develop preventive solutions to save lives and improve the environment which people live, work, and play. So far, we promote and raise awareness in Phnom Penh, mostly focused on children in kindergarten, primary, and school. We share the evidence of effects of over sweetened food and beverage, such as obesity, diabetes, tooth decay, and heart diseases directly to people and on billboard displays along the boulevard. And finally, I would like to thank to the unions and the Vital Strategy Ministry of Health, especially mayors of Bogor City and Indonesia, and Mayor of Balanga City in Philippines as a co-chairs of this summit. And thank you all the mayor and the participants from 78 cities from 12 countries. That's all for me here. Thank you very much.
Many thanks, Madam Keo. I would like to
धन्यवाद म फेरि पनि तपाईका के प्रश्नहरू छन् भन्दाखेरि एउटा एक्सनलाई चाहिँ 2022 सम्ममा चाहिँ र यसको नियन्त्रण र खास गरी चाहिँ यसको रेस्पोन्सको निम्ति तपाईको शहरमा चाहिँ के छ भने
briefly, ma'am. Should I repeat the question?
प्रश्न दोहोऱ्याउँदैछु
But I already answered after my first question already. Yes. I think I already answered the second question already.
र ठिक छ हुन्छ धन्यवाद धेरै अब
Great effort in Phnom Penh City. So I will move to Madam Renu Dahal, Mayor of Bharatpur.
मेयर भारतपुरको मेयर हुनुहुन्छ नेपाल.
Would you like to answer my question? What are the key success you made in tobacco control, such as smoke-free implementation, ban tobacco advertising in your city? And how would you see your leadership role in finding local solution and opportunity? Time's yours, Madam. Madam Renu? Madam, you still unmute. Could you unmute your speakers? We cannot hear you.
Good morning and good afternoon, everybody.
Good afternoon, ma'am.
छैटौं सम्मेलनमा
In
सहभागी
this sixth conference, all the guests, mayors, organizers, and campaigners against tobacco.
सिटी नेपाल प्रतिष्ठा भएको छ सरकारबाट इन्डोनेसियाको बगर सिटीमा सम्पन्न भएको छ
This sixth pact, I had opportunity to participate long back in the APCAT conference in the Bharatpur city. We decided to organize the program here, but due to COVID-19, the fifth conference virtually we conducted last year. In the fifth conference in the Bharatpur municipality, we declared smoke-free city. And in the fourth APCAT conference, till then, I have been making regulations to stop smoking in my municipality. And this is how I like to inform you. One, in the food conference, after I participated, immediately I returned Nepal in the Bharatpur municipality with the personnel and the staff, smoke-free city and a healthy city. In different phases, meetings were organized. So, Action Nepal with due to a study of Action Nepal, uh, it was a study of the situation of the Bharatpuri municipality for the regulations needed to stop the rules were not followed properly in the city. Third, and then the use of the sale of tobacco was controlled. With the Pradumna Prasad Upadhyay. A three-member committee was formed in order to stop it. Schools, colleges, principals, and people from the personnel from the hospital, Chamber of Commerce, and other stakeholders were invited. And then smoke-free and healthy city was made. And this is how we informed everybody. And the sale of tobacco, we informed all the people in the city with the different media. We informed not to use, not to buy, not to sell, not to consume. So all the 29 wards of Bharatpur municipality, the use of smoke was banned, and compulsorily everybody had to participate. The different informations were pasted in different corners with the wards of all the 29 wards in the municipality. All the government offices of Bharatpur municipality, with the support of all, the use of tobacco was compulsorily informed. that kind of signage was pasted in every corner of the cities, and the offices and industries, factories everywhere. Tobacco banned, prohibited June. Such kind of information was pasted in every corner of the city. All the schools, all the colleges, and all the and public places. And around 100 meters of around. No smoking, no tobacco was sold. This kind of information was transmitted with the help of making public hearing. So press conference also was organized, and if anybody would be found smoking, that he or she would be fined by 100 rupees. This kind of information was transmitted with the help of media, local FM stations, and more. So whether everybody is implementing the rules properly or not, for the enforcement, we have been monitoring properly. And as per law, some of the people were fined, and a certain amount of money, 96,000 rupees, was collected as a fine from the people who breached the rules. So fourth APCAT conference, after we reached the fifth APCAT conference, the different activities, what we have done, I have almost shared. Thank you very much.
Many thanks, madam. This is very important that you find people who smoke in public with 96 rupee, which is maybe height in Nepal. Yes, and this is one more question for me. What is your action for 2022, next year's? Your one action to improve tobacco control in your city?
हजुर हस् धन्यवाद। अब यो जो हामीले अहिले कार्य गरिराखेका छौँ यो कार्यलाई हामी अब निरन्तरता दिन्छौँ। यसको एकदम हामी नियमन गर्छौँ, अनुगमन गर्छौं। भरतपुर सिटीलाई स्मोक फ्री सिटीको हामीले घोषणा
So we do the monitoring after we have declared smoke-free city. So we have been implementing properly. Enforcement is strict, and to make a healthy city in future, of course, this campaign shall continue. So thank you for providing me this opportunity to share my ideas, and I wish all the best for the success of the conference. Thank you very much.
We are now who will be represented by Mr. Anwar Muhammad Zain. The time is yours. Thank you so much.
Okay, thank you, Menurita, and Assalamualaikum, and good afternoon, everybody. COVID-19 is a primarily respiratory illness, and as we all know, smoking adversely affects the respiratory and immune systems. In general, for COVID-19 patients, the condition of smokers will likely deteriorate faster compared to the non-smokers. Lately, with these tobacco control efforts, one can hardly see KL-lite smoking in restaurants, outside of malls, or on the walkways. And as they have to spend more time indoors during the pandemic, we introduced a virtual KL Smoke-Free City Run program that was held from 1st April 2021 until 30th September 2021. That is for 6 months. And Kuala Lumpur City Hall believe this virtual run program could be a great opportunity to promote a healthier lifestyle for the people of Kuala Lumpur to participate. A total of 22,000 participants joined this program with an approximately 16 billion step counts. With this initiative taken during the pandemic, we hope that smoking in the city would consequently be a lot reduced. Furthermore, Kuala Lumpur City Hall has established a Kuala Lumpur Smoke-Free City Committee, also known as Kuala Lumpur Bebas Asap Rokok, a smoke-free Kuala Lumpur, that is KLBA, in May 2017. This initiative specified a range of activities in compliance with the enforcement of smoke-free areas. We localized our efforts by strengthening and amending 10 local government acts 1972, such as bylaws regarding licensing of trades, business and industries, public housing, licensing of food establishment, public parks, wholesale market, and licensing of hawkers. And that is for the first question, Madam Rita.
And my second question is, what is your plan for next year's to improve the tobacco control in Kuala Lumpur and also improve NCD-19 response? Please answer briefly.
Before that, I just add my answer to my first question. Indeed, one of the best options besides legal enforcement is creating community awareness. More awareness programs are being held in Kuala Lumpur for the citizens, government agencies, private sectors, and NGOs to promote healthier lifestyle by sharing information on the negative effects of tobacco to the public. And for the second question, by next year, Kuala Lumpur City Hall will provide capacity building programs to empower our officials with knowledge and skills regarding tobacco-related enforcement. This training will also be provided to public transport management and shopping complexes management officials, where the gazetted areas for free smoking zone will be implemented. The Department of Health and Environment, Kuala Lumpur City Hall, will conduct enhanced enforcement at all of the 24 gazetted public areas, including approximately 7,000 registered restaurants and dining areas in Kuala Lumpur. And we will continue our campaign to promote public awareness and integrate a few health-related events for the community to ensure the public receives the latest information on tobacco control and COVID-19 related updates. That's from Kuala Lumpur. Thank you.
That is great program, Mr. Anwar, and really innovative program with your virtual health program. Yeah. Thank you. Thank you so much. So we will move to Madam Dr. Guillermina Filomena Saldana, Mayor of Dili City, Timor-Leste. Here. Madam Guillermina from Dili City, Mayor of Dili City. You still unmute. Please unmute. You still mute. Madam Mayor, please unmute your audio. Many thanks. Many thanks. Good afternoon, madam. Good afternoon, madam. Can you hear me? Can you unmute your audio, madam?
Hello, good afternoon.
Good afternoon.
So I am the translator. I will translate Madam Guillermina presentation.
Oh, okay, many thanks. So my question is, what are the key success you made in tobacco control, such as smoke-free implementation, ban on tobacco advertising and sponsorship in your city while responding to COVID-19? And how would you see your leadership role in finding local solution and opportunity to improve control tobacco smoking and CD in your city? Time is yours, ma'am.
Thank you for time. It's my great honor to participate in this very important meeting. The government of Timor-Leste has approved the National Tobacco Decree Law in 2016, which promulgated by the President of the Republic. This tobacco law complemented comprehensively the Empower Package approach from WHO. The Ministry of Health, with partners and civil society, have been developed a 3-year multi-sectoral action plan for non-communicable disease, which lead each government sectorial to enforce the implementation of the tobacco law. Dili municipality have integrated and implemented the action plan to package essential for non-communicable disease in primary healthcare. The focus of this program is to do early detection for pulmonary disease, heart disease, hypertension, diabetes, cancers, and offer regular treatment. After the tobacco law approved commenced in 2017, all government offices in Delhi immediately banned tobacco smoking and banned tobacco promotion, publicity, and sponsorship. We will continue to enforce the implementation of the tobacco law to ensure it meets its objective. On the other hand, during the pandemic, Delhi municipality collaborated with World Health Organization, organized first launch to the tobacco cessation clinic in October. We also have established the quit line. The clinic has shown a good progress. During these 2 months, we have treated for more than 158 smokers. Since August, the number of COVID-19 has decreased from 50 to 3 people. Our early data shown that in this last week, Delhi registered 0 cases of COVID-19. I am aware that leadership and good governance is one of important pillars for public health. Thus, I would continue to provide my leadership to organize the multi-sectoral work for non-communicable disease and tobacco control to achieve its plans and objectives. I would also continue to provide leadership to control of COVID-19 mitigation and continue to do awareness activity for the danger of tobacco to the young people.
Thank you, madam. This is one last question. What is your next year's program?
In 2022, we will enforce the multi-sectoral work through effective implementation of integrated work plan for non-communicable disease and COVID-19. We will continue to enforce smoke-free in places such as garden, markets, and schools. This include established smoking space in public places. We will continue to maintain daily outdoor gym to continue promote physical activity every day, also organize walk the talk program every week. Last but not least, Delhi municipality with mayor mayors committed to work together with other 3 mayors and civil society to establish mayor alliance in Timor-Leste in the near future. That's all. Thank you.
Many thanks, madam, for your leadership to cut the COVID cases to 0 and to expedite tobacco control in your Delhi city. Many thanks. So because we are running out of time, we will move to Mr. Golam Kabir, Mayor of Damrai Upazila, Dhaka District, Bangladesh. Please, Mr. Golam, the time is yours.
Thank you.
Thank you.
Good morning, good afternoon.
Good morning, good afternoon.
Good afternoon. So as previously told that I will ask a very short question is what are your steps you made in tobacco control in your city and while responding to COVID-19, and how would you see your leadership role in finding local solution and opportunity to improve control of tobacco smoking, and city and other disease in your city? Time is yours.
Thank you. Thank you. 6th APCAT.
On behalf of Damrai municipality, I would like to extend my best wishes to all. Thank you for giving me the opportunity to speak at the conference. I have participated in this conference before, which inspires me to control tobacco, non-communicable diseases, and build a healthy city. Tobacco is a very harmful thing. People dies from tobacco related disease. So I am I'm conducting interrupted activities in my municipality, implemented the declaration of our Honorable Prime Minister to build a tobacco-free Bangladesh by 2040. At a time, uh, at a time, and whom are dying there, whom are an advertisement campaign for tobacco products in the city has been kept under the surveillance. A regular monitoring is done by municipality. Various steps have been taken to create tobacco smoke-free environment, to create a public awareness, to run mobile courts with the tobacco. Every for public space, no smoking signage has been set. Various events are organized for the campaign. Various programs have been taken. Municipality anti-tobacco campaign and campaigns are organized for the participation of the politicians, leaders, and representatives. They are getting monitored by the municipalities, and anti-tobacco. The advertising of campaign for the tobacco products city has been kept under surveillance. Regular monitoring is done by municipality. Various steps have been taken to create a smoke-free smoke. In this regard, the concerned municipal officers have been participating in several workshops with a view to acquiring special capabilities. Various events are organized for the campaign because I think it is actually a if this movement can be spread to all the levels of society, it will play a helpful role achieving in the desired role. Tobacco companies made various efforts to disrupt the name of CSR. They plan various projects and try to involve the municipality in them. We never say yes to such proposals. They try to influence local quarters efforts. If the shopkeepers is fine for the advertising through the mobile code management, they pay the shopkeepers. They pay the shopkeepers, compensate for that fine. Thus, through various processes, they create obstacles in implementation of the tobacco control law. According to the law of local government bodies, the main responsibilities of protection of public health of the city lies with the municipality or the city corporation. According to the law, municipality has opportunity to play various roles in protected public health. In the meantime, the local government department has published guidelines for implementations of tobacco control activities of local government institutions. Under the guidelines, it is possible to control tobacco in the municipality. In addition, we have plans to take several initiatives locally to remove those who sell tobacco products from the business tobacco products by creating various incentive opportunities and providing various opportunities to citizens, municipalities, to prevent them from using tobacco. To do more awareness, I want everyone to
could you this, because the time is up. Okay.
Joy Bangla, Joy Bangla.
Many thanks, Mr. Golan. Thank you so much for your insight program and also refusing CSR working with your municipality. Thank you so much. This is
thank you so much.
I will invite Madam Rafika Akhtar, Mayor of Saidpur, Rangpur District, Bangladesh. Madam, your time.
Good morning, madam.
Good afternoon. Good afternoon, Madam Rafika.
Good afternoon.
As you see in the screen, that's the question that you can answer directly because we are running out of the time. Thank you, Madam Rafika.
Thank you. 6 APEC 2021
On behalf of
Indonesia
Saidpur
Pacific
Municipality,
Summit
I would like to
মেয়র
extend my
অংশগ্রহণকারী
heartfelt greetings
সম্মানিত
to all
সভাপতি,
the distinguished
মেয়রবৃন্দ,
presidents, mayors,
বিশেষজ্ঞবৃন্দ,
experts, and
সিভিল
members of the
সোসাইটির
civil
সদস্যবৃন্দ
society who
সকলকে
participated
সৈয়দপুর
in the
পৌরসভার
6th
পক্ষ
APCAT.
থেকে
I
শুভেচ্ছা
want
জানাচ্ছি।
to
আজকের এই সম্মেলনের অংশগ্রহণের মাধ্যমে আমরা আমাদের
by
পরস্পরের
participating in
কাজের বিষয়ে
today's conference,
জানতে
we
পারছি
learned
যা
about each
আগামী
other's
দিনে
work, which will
তামাক
help the future
অসংক্রামক রোগ
to
নিয়ন্ত্রণ
control
তথা
tobacco and
স্বাস্থ্যসম্মত
non-communicable
নগরী গড়ে
diseases
তোলার
and
ক্ষেত্রে
build a
সহায়ক
healthier
হবে।
city.
বাংলাদেশ সরকারের স্থানীয় সরকার
The local
বিভাগের
government
উদ্যোগে
department of
স্থানীয়
the
সরকার
government of
প্রতিষ্ঠানে
Bangladesh
তামাক
has
নিয়ন্ত্রণ
formulated
কার্যক্রম
guidelines for
বাস্তবায়ন,
implementation
নির্দেশিকা
of tobacco
প্রণয়ন
control
করছে।
activities of
উক্ত
local government
নির্দেশিকা
institutions.
বাস্তবায়নের অংশ
As part of
হিসেবে পৌরসভা চত্বরকে
implementation of the
ধূমপান
guidelines, the
মুক্ত এলাকা
municipality
হিসাবে
premises has been
ঘোষণা করা
declared
হয়েছে।
as
পৌরসভার
non-smoking
বাজেটে
areas.
তামাক নিয়ন্ত্রণে
Separate
পৃথক
allocation
বরাদ্দ
has been
রাখা
made
হয়েছে।
to made
আমাদের
in the budgets
এলাকায়
of the
তামাকজাত দ্রব্যের
municipality
ভুল
for
অনেক
tobacco
কারখানা ছিল।
control. There
লাইসেন্স
were
আরোপ কড়াকড়ি করার
many
কারণে
factories of
এই
tobacco products
কারখানাগুলির
in our
সংখ্যা পূর্বের
area
তুলনায় অনেক হ্রাস পেয়েছে। খুচরা তামাকজাত দ্রব্য বিক্রয়ের জমি আনার জন্য তাদের নতুনভাবে লাইসেন্স ইস্যু করা হচ্ছে না। সেক্ষেত্রে যে সমস্ত দোকান অবৈধভাবে তামাকজাত দ্রব্য উৎপাদন ও বিক্রয় করছে, উপজেলা ট্রান্সপোর্ট কমিটির সহায়তায় তাদের বিরুদ্ধে ব্যবস্থা গ্রহণ করা হবে। LGI গাইডলাইনের নির্দেশনা অনুসারে
as per LGI guidelines,
100 মিটারের
as
মধ্যে
we know,
সকল ধরনের তামাকজাত দ্রব্যের
all types
ব্যবহার
of
ও
tobacco
বিক্রয়
products within the
নিষিদ্ধ
100
ঘোষণা করা
meters of
হয়েছে।
educational institution and
আমরা
healthcare
জানি
centers have been banned
অসংক্রামক
as
রোগ
per
বিস্তারে
guidelines.
একটি অন্যতম
As we
প্রধান
know,
কারণ তামাকজাত।
the use of tobacco products
দ্রব্যের
is one of
ব্যবহার
the major
আমরা
causes of
আমাদের
spread
শহরে
of
তামাকজাত
non-communicable
দ্রব্যের
diseases.
ব্যবহার
We
শূন্যের
have
কোটায় নিয়ে আসার
adopted
মাধ্যমে
a
অসংক্রামক রোগ
non-communicable disease
প্রতিরোধের
prevention plan by
পরিকল্পনা
reducing
গ্রহণ করছি।
use of the
বাংলাদেশ তামাকজাত দ্রব্য
tobacco
দ্রব্যের
products
নিয়ন্ত্রণ
to zero
আইন
in our city.
2005 সংশোধিত,
Administration measures are
2013
taken to
তামাক
prevent
নিয়ন্ত্রণ
the
বিধিমালা
advertisement of
2015
tobacco products
বাস্তবায়নের
with the
ক্ষেত্রে
help of local
স্থানীয়
administration in the
প্রশাসনের সহায়তায়
implementations of
তামাকজাত দ্রব্যের
Tobacco
যাতে
Use Control
বিজ্ঞাপন
Act
প্রচার না করতে পারে সেজন্য
2005-2013,
প্রশাসনিক ব্যবস্থা গ্রহণ করা
Tobacco
হয়ে থাকে।
Control Rules 2015
তামাকজাত দ্রব্য
in Bangladesh.
বাজারজাতকরণের
We
আমরা
are always
সবসময়
vigilant in
সতর্ক
marketing tobacco
থাকি যাতে
products
আইন
so
বহির্ভূত কোনো কাজ
that
না
no
ঘটে।
illegal activities
পাবলিক
take
প্লেস
place.
পরিবহন তামাকজাত দ্রব্যের ব্যবহার
Guidelines
বন্ধ
are
করার ক্ষেত্রে
taken
গাইডলাইন অনুসারে ভূমিকা নেওয়া হয়।
to
এই সকল
intact
কর্মকাণ্ড
prohibited
সম্পাদনের
use of
জন্য
staples in
আমাদের সকল
public
কাউন্সিলরবৃন্দ
places
মাঠ
and in
পর্যায়ে কাজ
transformation.
করছেন।
All of our councillors are
কমিউনিটি
working in the
সম্পৃক্ত
field
করে
to
এই
carry out
সকল কাজ করা
all these
হয়।
activities. All
পৌরসভার
this is
এলাকায়
done by
কমিউনিটি
involving
পুলিশিং
the
ব্যবস্থা
community.
চালু আছে।
Community policing is in the place in
তাদের
municipal
তামাক
areas.
নিয়ন্ত্রণ কার্যক্রম
They
সম্পৃক্ত করা
have
হয়েছে।
been involved
এছাড়া
in
বিভিন্ন
tobacco
এনজিও
control
তাদের
activities. In
কর্মকাণ্ড
addition,
পরিচালনা
various
করে
NGOs
পৌরসভার
conduct
পক্ষ
their
থেকে
activities
তাদের
in
কাছে
the
সক্রিয়
municipality
সহযোগিতা
provides
প্রদান করা হয়ে
active
থাকে।
support to their
ধূমপানের পরোক্ষ ক্ষতি থেকে নাগরিকদের রক্ষা করার জন্য পাবলিক প্লেসে যাতে ধূমপান না করতে পারে সেজন্য কঠোর নজরদারি করা হয়।
Madam Rafika, because this is a very short time, so we go through the next question is your plan for 2022.
Thank you.
Very short, very short.
Short, তামো এইটুকু হবে। পৌরসভার পক্ষ থেকে উপজেলা প্রশাসন সহ অন্য সকল অংশীজনকে সম্পৃক্ত করে নির্দিষ্ট পরিকল্পনা গ্রহণ করে একটি রোড ম্যাপ ঘোষণা করা। মাননীয় প্রধানমন্ত্রীর ঘোষণা 2040 সালের মধ্যে তামাক মুক্ত বাংলাদেশ বাস্তবায়নের জন্য স্থানীয় পর্যায়ে আমরা একটি নির্দিষ্ট সময় নির্ধারণ করে ঘোষণা দিতে চাই সৈয়দপুর শহরকে তামাক মুক্ত করা। এভাবে প্রত্যেকটি পৌরসভাকে যদি আমরা তামাক মুক্ত করতে পারি তবে মাননীয় প্রধানমন্ত্রীর ঘোষণা বাস্তবায়ন সহজ হয়ে যাবে বলে আমরা মনে করি। সবশেষে আজকের এই সম্মেলনের সফলতা কামনা করে আমাকে বক্তব্য দেওয়ার প্রদান করায়
city tobacco free. In this way, if we can make every municipality of the country tobacco free, then we think it will be much easier to implement declaration of the Honorable Prime Minister. I would like to conclude my speech by thanking the authorities for giving me the opportunity to speak on the success of today's conference. Thank you.
Many thanks, Madam Rafika. This is our last speaker, is Mr. Gaurav Gupta, Chief Commissioner of Bruhat Bengaluru Metropolitan Karnataka in India. Mr. Gupta.
Good morning, everybody. Our Honorable Chief Commissioner Gaurav Gupta ji is held up in a meeting. So I am representing him on behalf of Bruhat Bengaluru Mahanagarapalikhe. I am Dr. Balsundar, Chief Health Officer, Public Health, BBMP. Good morning, ma'am, and good afternoon to everybody.
I should repeat your the questions. What are the key success you made for the tobacco control in your city? And how would you see your leadership role in finding local solution opportunities to improve control of tobacco smoking and NCD in your city? Time's yours.
Ma'am, city tobacco control cell, we have one cell especially for this kind of activity, which is very active and working towards better implementation of tobacco control programs. With regard to the smoke-free Bangalore initiative, a lot of focused activities are done on enforcing the Cigarette and Other Tobacco Product Act, which is a central government act, in which Section 4 mandates the display of no smoking signage and prohibits smoking in public places. We are very much we are enforcing it. Implementation of smoke-free laws includes enforcement in public places and creating awareness among the public about their rights and law. Enforcement from other stakeholders involvement of associations of like hotels, bar and restaurants, etc. to work together to create smoke-free environment in the city and protect non-smokers from the harmful effects of the second-hand smoking. Awareness and stakeholders involvement have been carried out. More than 20 capacity building programs for various enforcing officers and other key stakeholders to ensure tobacco control issues are well focused. Over 20 school awareness programs highlighting the harms of tobacco use were conducted, in which more than 3,500 children have participated. Conducted over 40 focus group discussions with various stakeholders like drivers, city civic teams, slum dwellers, hotel employees, etc. to create tobacco de-addiction. We have undertaken many communication campaigns, including radio campaigns, outdoor, LED AV campaigns, three-wheeler campaigns with banners, city bus campaigns, street plays, online campaigns, etc. Over 50 enforcement drives were conducted for the removal of designated smoking areas and on banning public place smokings with active support from BBMP leadership along with health officials and police department.
Mr. Gupta, could you shorten your speech because we are running out of time? Thank you so much.
We are creating an NCD task force to strengthen NCD policies and passing an order for removal of designated smoking areas and following the specifications stringently as per Court Pact. Banning during COVID time, we have banned spitting in public places and banning tobacco chewing. These are strictly enforced. Over to you, ma'am.
Many thank you. Many thank you so much. So what is your plan for 2022, Mr. Gupta?
Plan is to formulate a regulation for hookah usage in the city limits with inputs from subject matter experts and legal experts. Set up a committee to oversee designated smoking areas, implementation in the city and follow up with enforcement drives. Ensure task force members and regularly to plan and oversee overall progress and strengthen NCD non-communicable disease policies. Education institutes to be declared as smoke-free zones by enforcing Section 6 of Court Pact and issue notices to cancel trade license for the violation. Further strengthening of the
Only
COVID
one,
response team.
only one action, Mr. Gupta. Okay, thank you.
Thank you.
Okay, many thanks for your explanation of your excellent programs in your city. And we will continue our session with video from Mayor Bapak Gibran Rakabumi, Mayor of Surakarta. Over to you, Sabita, for the video.
Everyone has the right to live in physical and spiritual prosperity, to have a place to live, and to have a good and healthy living environment. These are the basic rights. And when these basic rights are compromised by secondhand smoke, the government has to ensure that everyone has access to clean air. Recent studies have found out that the trend of smoking behavior in our society is likely to be decreased. Based on the result of data collection on clean and healthy life behavior, the percentage indicator of non-smoking families shows an increase. It means that the people are getting aware of how dangerous and useless smoking are. Some of them might realize that they can use their money on something more useful rather than to burn it. The regulations for non-smoking areas and smoking restricted areas was first issued in 2010 by the stipulation of the Mayor Regulation number 13/2010. Then in 2019, the House of Representatives have approved and enacted City Regulation number 9/2019 about non-smoking areas. Within the time span of 2010 until 2019, Surakarta government have several actions in terms of no smoking campaign, such as 1. Socialization, extensive socialization for government officers, professional, student, and whole community. 2. Creative poster competition and anti-smoking campaign. I believe this will encourage people to be creative and at the same time campaign about the danger of smoking. 3. Handstand movement. This was the Indonesian Record Museum, or MURI, record-breaking attempt for the most handstand movement for anti-smoking campaign back in 2014. 4. Creative anti-smoking poster competition for the youth, involving young people to explore their creativity because they are the one of the most vulnerable to smoking exposure. 5. Klinik Berhenti Merokok. Establishment of Klinik Berhenti Merokok or Smoking Cessation Clinic. The purpose of this clinic are to increase public awareness on the danger of smoking, promote healthy lifestyle, help and assist patients who are trying to quit smoking, as well as to improve public health. 6. Kader anti-rokok. Formation of kader anti-rokok or anti-smoking cadre. Their prominent role are as a motor or motivator for the young generation to avoid smoking and to provide information about the dangers of smoking and information regarding non-smoking areas and smoking restricted areas regulation to peers. 7. Establishment of smoking area in government offices, district offices, House of Representatives, courthouse, bus terminal, and the city hall. 8. Kampung Bebas Asap Rokok, or no-smoking villages. It is a pilot project that actively supports anti-smoking campaigns, including the building of smoking restricted area on each village, socialization of the dangers of smoking, and implementing healthy living norms in the community. According to City Regulation number 9/2019, non-smoking areas in Surakarta covering 8 areas including health facilities, educational facilities, worshiping places, playground, sports facilities, public transport, workplace, and public space. Furthermore, to encourage public and community involvement in the implementation and monitoring of the tobacco control program, Surakarta government have launched monitoring app data collection called Pantau KTR, or Non-Smoking Area Watchers. It includes several features such as open access for community involvement in no smoking campaign, downloadable on Play Store, increase community compliance, and facilitate the non-smoking watchers monitoring and enforcement team in taking action against any violation. We need to build and maintain cross-sectors networks and fostering public-private partnership to protect the development and implementation of public health policies from undue influence of unhealthy community industries. I hope we can share best practices and lessons learned in policy development and implementation to protect public health, and how to empower public and community involvement in the implementation and monitoring of the tobacco control program.
Many thanks, Bapak Gibran. We do apologize for not being able to hold Q&A session because of time constraint. I would like to express my gratitude to all the honorable panelists, to participants of this important session, and we can learn how all leaders in the Asia Pacific implement their tobacco control program amid the pandemic. And we do apologize for all that also ask the questions, so we cannot continue with the question and answer session because we have to move to session 3, which will be moderated by Madam Soba Sukla, Executive Director of CNS Citizen News Service and the founder of APCAT Media for Health and Development. Over to you, Soba.
Thank you, Rita, and namaste from India. Continuing with today's program, I welcome all of you to the third session of today, which is on sustainability. This session will highlight Mayor's efforts to invest in and sustain local health system capacity and programs for tobacco control, vaccinations, and preventing NCDs. Leaders will share evidence, lessons learned to improve program outcomes, and the session will also recognize the importance of leadership at all levels and highlight the support that is needed across sectors and organizations. I now invite Dr. Kung Heng Nung, Founding Director of Tobacco Free Generation International, to kickstart this session by sharing his thoughts. Over to you, Dr. Nung. Please unmute yourself.
Yes, namaste, Shobha.
Namaste.
And good afternoon, ladies and gentlemen. Thank you for the kind invitation to share with you the next level of tobacco control, specifically tobacco prevention. I've heard the honorable mayors doing excellent work in implementing the current measures that have been promoted by the World Health Organization since the FCTC was started. But allow me to now introduce the next level of tobacco prevention, which is called Tobacco Free Generation International Endgame. And I'd like to take you through how we have designed this concept through youth leadership and developing a massive mass education ecosystem that will enable better social cohesion and better governance by your good self. I will specifically present what is available from our organization for you and your people to implement. And this is all based on our experience working with Mayor Francis, Mayor Gila, Congressman Joet Garcia, and many other Philippines mayors since the year 2016. So as leaders, I think you seek these vital components in your directions and governance. You want support and synergy from your people to rally behind a cause, a motion, a bill, or legislation. You want sustainability and scalability, and you want the science behind it, where there has to be data, there has to be professional endorsement, and even better, the rest of the world to follow. You also want the program to be cost effective so that it provides value to your government, to your society. And the good news is what is available from tobacco-free generation now is able to fulfill such ambitions. We provide copyright-free, relatable education material. And we also have now a very strong learning platform that is done both online and on-site for deep engagement of your community. Municipalities who have worked with us, having seen the material and how we have structured the youth leadership development program, then gradually incorporates what we have taught into their governance structure, which I will illustrate using the Philippines and the South African experience in a short while. We do have international traction, and we share data, we collect data in order to endorse various youth leaders and provide them accreditation so that they become the future of and our teachers for the tobacco-free generation notion. In most recent times, because some of the youth struggle with their own internet data support, we also provide funding to support their internet data so that they can learn. We encourage them to make local content that will be relatable to their own people. So these are some of the things, resources that we provide in promoting the tobacco-free generation notion. The good news is that the tobacco-free generation endgame has now achieved the world's first city in the US to adopt tobacco-free generation legislation. This is second worldwide after Balanga City in 2016, where Balanga becomes the world's first tobacco-free generation city that started with the tobacco-free generation legislation using the birth year 2000. So this resource is easily available through our website. From here, we have easily 100 over postings that will showcase the various concepts and various activities that we have done over the years. We also have videos. Once you're in the website, you click here, you can easily get our video resources so that you have an idea of what we do across different municipalities. So having shown to you the ultimate outcome where you can now make a tobacco-free generation law for your society in order to provide that sustainability, let's backpedal a little bit to understand why we need to do this. Because experts have shown that if we continue with the current measures of trying to increase cessation, trying to increase effort in pushing for the empower measures, whether it's 25% more effort or 50% more effort, you notice that projecting out to 2050, the prevalence is never going to reach down to zero. It is for this reason, key opinion leaders, thought leaders like Professor Ruth Malone, Professor Richard Daynard in the US have identified the tobacco-free generation concept as the ultimate end game. So what is tobacco-free generation? Very briefly, all right? So you can easily scan this QR code if you want to digress a little bit, but let me continue what tobacco-free generation is all about. It's about a community deciding on a certain birth year. For example, in Balanga, they choose year 2000 birth year, and other communities, now that we are in 2021, I am suggesting that new municipalities coming on board will choose year 2010. You educate this group better such that this group will forever not allowed to use or do not want to use cigarette, whether it is before 18 or after 18. You see how the birth year concept is now the key to the tobacco-free generation concept, because you now have a new generation that will never smoke. Using a visual, if you implement 2010, you teach this cohort never to smoke. And now immediately within this cohort, you have 0 smokers. In 2023, you teach the next cohort, again, another generation of never smokers, such that over time, you will then have a completely new social norm where smokers will continue to have normal attrition, but at the same time, we have not antagonized any of them, because this is a preventive measure that is focused on your new generation. I don't have time today to tell you how tobacco-free generation overcome all these blind spots that we have not been aware of, but we continue to accept them as normal. But these are the key blind spots that hold us back from being ever successful in overcoming against the industry. So where do you get your resource, and what do you share with your constituents or your community leaders or your municipality leaders when you go back? So feel free to browse our website where you will see this, and you can easily also go to the Tobacco-Free Generation Facebook pages of Dina Lupihan and Balanga City to get the visual of what they have been doing. Besides the website, if you go to the video section, you will see a myriad of 40 over videos that you can see how we have gone to different places to engage the young, so that they are the ones who speak up against the industry, motivate their peers to speak up, and demonstrate that social norm. It is not asking the community leader to stand up and then be subjected to target by the industry, but it's now the society standing up. The various more than 100 over posts in this website will tell you where we have been, what youth in other parts of the world are doing, feedback from teachers to the education program that we run, as well as demonstration of various activities that we have done both in Philippines as well as in Jakarta. We also have material that will show you how tobacco-free generation is able to mobilize hundreds and thousands of students to be excited about a program. And after such program, when we did our survey and analysis, 90% of the targeted young people support the way we have done. If you need a legislative perspective, feel free to browse the Public Health Advocacy Institute based in the US. They have a template that will give you the model of how the tobacco-free generation legal language is phrased. And according to Professor Richard Daynard, the tobacco-free generation is a simple, bold, and legally viable concept. So recently with the Zoom, we have started educating the youth. We conduct different Zoom sessions to train Filipino youth, as well as youth from other parts of the world, to come together so that they know how to articulate the tobacco-free generation concept better. We train them, and then we issue them a certificate of participation. And in this last presentation, the youth, having been trained, will do a return presentation to us so that they know the key principles of tobacco-free generation. The beautiful part about this is this youth, having internalized it, they can express it in their own language, their own lingo that is applicable to their generation, and get connection better. Here are just last 3 to 5 slides.
Thank you, Dr. Noon. Can you please speed up, because we are running short of time.
Right.
So
just to show with you, let you see some youth leaders who have now garnered their society, reaching out to hundreds and thousands of their own community people. And this is the ordinance made by Balanga City in 2016, creating the world first tobacco-free generation ordinance. So I close with showing you the conclusion. Feel free to contact me. Feel free to scan this and provide a feedback to register your interest. We're happy to interact with your community so that you will then save your future generations and save massive healthcare costs from tobacco-related diseases. Thank you very much.
Thank you very much, Dr. Nong, for highlighting the importance of creating awareness and educating the youth to thwart the nefarious tobacco promotion campaigns of the tobacco companies, which are solely directed at the youth. Our next speaker is Dr. Pauline Chan, Acting Team Lead on Viral Hepatitis, STI, HIV, Hepatitis, and Sexually Transmitted Infectious Unit, Division of Programs for Disease Control at the World Health Organization. Welcome, Dr. Chan, and over to you.
Good day to all. I thank the organizers for inviting WHO to present on viral hepatitis in Asia and the Pacific. Before we start, I'd like to tell you about hepatitis. Hepatitis means inflammation of the liver. We have 5 different hepatitis viruses. Each of them affect the liver. Hepatitis A and E are transmitted through oral fecal routes. So hand and foot hygiene is important. Clean and safe water is the foundation for this. Hepatitis A and E are generally short illnesses. Hepatitis B, C, D are transmitted through blood and body fluids from an infected mother to her baby, from unsafe injections, unsterile injections or dental work, and unscreened blood products. Hepatitis B and C viruses causes chronic infection. Thus, health and dental services are delivered at good quality, ensuring safe injections and prevention is done correctly, and making sure all people who need health services can get it. Now, these are important. 350 million people live with hepatitis B and C globally. By the time I finish talking to you about this slide, 3 persons would have died somewhere from hepatitis B and C. And they die from chronic infection of hepatitis B and C, which affects the liver over time and causes cirrhosis and eventually liver cancer. All these premature deaths are unnecessary because we have good tests and drugs that can treat hepatitis. And hepatitis C can be cured. Asia and the Pacific comprises more than half of the world's total numbers of people living with hepatitis B and C. We have about 200 million people infected with hepatitis, and most are not aware that they are infected. The World Health Assembly has called for hepatitis elimination as a public health threat by 2030 as part of the Sustainable Development Goals. A new WHO Global Health Sector Strategy for viral hepatitis is under development for the coming decade. Elimination as a public health threat is a combination of existing interventions at scale. These include ensuring universal free childhood vaccinations of 3 doses of hepatitis B vaccines, prevention of mother-to-child transmission interventions during antenatal care, ensuring safe blood and blood products so that transfusions are safe, making sure that there is universal precaution in healthcare settings, and ensuring safer sex programs. And for people who inject drugs, to ensure there's harm reduction, interventions for these and to prevent new infections among them. And of course, to ensure tests and affordable drugs are available in healthcare facilities nearer to where people live. We have countries in this conference that have success in achieving WHO's 2020 targets for prevention of hepatitis B through vaccination. Vaccination is a foundation for hepatitis B, prevention of new infections. And the latest scientific evidence shows that there is a group of pregnant women who are more at risk of passing the hepatitis B virus to their babies. These are pregnant women who are themselves hepatitis B infected. WHO's new guidelines now provide recommendations so that we can further prevent hepatitis B transmission from an infected pregnant woman to her baby. And these include the possible use of drugs that can stop transmission. Universal testing during antenatal care for HIV, syphilis, and hepatitis B is the entry point so that we can get affected pregnant women into the care that she needs. The WHO's framework for triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B brings together integrated maternal child care so that the next new generation of babies can be free of infectious disease such as HIV, syphilis, and hepatitis B. Today, we have almost 200 million people in Asia and the Pacific who are chronically infected with hepatitis B and C. And they are at high risk of developing liver cancer.
Thank you, Dr. Chan. And now
But
we will play.
Liver cancer can be prevented. If you take action today, you can prevent liver cancer of tomorrow. To reduce liver cancer and advanced liver disease, such as cirrhosis, an effective way is to provide testing services so that people can know their own hepatitis status and can get linked to health services and get drugs to treat hepatitis. In this way, the rising epidemic of liver cancer deaths that we see in many countries in Asia now can be reduced. COVID-19 has transformed the world and changed us all. Even in the midst of the pandemic, we must intensify preventing our new generation of babies from being newly infected with hepatitis B. This means investing in childhood vaccination and prevention of mother-to-child transmission interventions to get to elimination. For the millions of people living with chronic hepatitis B and C today, they are at high risk of developing liver cancer. Most are not aware. But liver cancer can be prevented by ensuring testing and treatment for all who need it. Because cancer, once developed, will cost all of us even more. At the cusp of the next decade towards getting to SDGs 2030, we do have a menu of tools to prevent, to treat, and effective medicines. Hepatitis C can be cured. Hepatitis B can be effectively treated. And we need to work towards strengthening health systems, towards universal coverage, including hepatitis, to optimize service delivery nearer to where people live at primary care, work with the private sector and communities to expand services and reach, and most importantly, to assure equitable access to hard-to-reach groups. We do have the next decade towards achieving the sustainable goals of 2030. And together, we can get to elimination of hepatitis as a public health threat. Thank you.
Thank you very much, Dr. Chan, and sorry for the interruption in between. We will now see this video, End Hep Call to Action. So please watch the video, End Hep Call to Action video.
350 million people are chronically infected with viral hepatitis around the world. 1.4 million will die of it this year. And the most tragic part of this global pandemic, we have everything we need to stop it. In 2015, the Strategic Development Agenda set the ambitious goal of eliminating viral hepatitis around the world by 2030. Working with the World Health Organization and other partners, the Hepatitis Fund, also known as End Hep 2030, has made that goal its mission. We are the only grant-making organization dedicated exclusively to ending viral hepatitis. The world has the diagnostics, inexpensive vaccines, and effective treatments to do it. But we need to encourage national governments, leverage private philanthropy, and galvanize civil society to commit the finances and political will to make it happen. The Hepatitis Fund will catalyze the elimination of the disease. Our funding will support increasing awareness about the reach of this silent killer. It will also support the development and financing of national plans for eliminating the disease in low and middle income countries. And it will help strengthen existing healthcare systems so they are capable of delivering quality hepatitis testing and treatment in innovative ways that are replicable and scalable, even in the poorest countries. We mobilize philanthropy and government financing to make these plans possible. The solution is at our fingertips. End Hep 2030 can help deliver it, leveraging the resources and inspiring the global commitment to save millions of lives.
Our next presenter is Wangsheng Li, co-founder and founding president of the Hepatitis Fund. Over to you.
Thank you, Madam Chair. Good afternoon, the honorable mayors, delegates, and participants. First of all, congratulations to the organizers of the 6th Asia-Pacific Summit of Mayors. I wish to take this opportunity to applaud the mayors for your steadfast commitment and collective leadership in building a healthier society for your community. And I appreciate this opportunity to address the virtual assembly.
You are muted, sir. Please unmute yourself.
Okay. Can you hear me?
Yes, yes, we can hear you.
Okay, wonderful. So thank you again. And the presentation we just heard by Dr. Pauline Chen moments ago makes a compelling argument that the elimination of viral hepatitis should be part of any sound public health agenda. The NHEP 2030 project strives to be a catalyst in this broad effort through high-impact private and public partnerships. And we're very excited about the new partnership APCAT and NHEP 2030 have recently formed to take the daunting challenge of viral hepatitis head on. A major public health threat to the global community, viral hepatitis exerts particularly heavy tolls on the Asia and the Pacific region, where we see over 50% of the global burden of the disease, from which one person dies every 20 seconds. And this calls for systems approach at all levels of the public health sector. Just as the former director of World Health Organization Western Pacific region, Dr. Xing, succinctly pointed out, bold and decisive actions are needed. With a strong political will and a collective commitment, we can achieve the regional goals of eliminating viral hepatitis, one of the UN Sustainable Development Goals for 2030. I look forward to working with you and all the constituencies in the region, and thank you for your attention.
You are muted. Okay, sorry, sir. You're
Thank
muted.
you. I'm over. I'm done. You're running out of time, so I cut it short for you.
Okay, thank you, Lee, for focusing on elimination of viral hepatitis, which indeed is a global health threat. After getting a glimpse of some global and regional scenarios, we are now really keen to know how the local leadership has been responding to sustain various health programs at their city level, even in these difficult times of the COVID-19 pandemic. We are very fortunate to have with us leaders from different cities across the region to share their ground level experience related to tobacco control, NCD prevention, and vaccinations. In this part of the session, I will ask the same two questions, one after the other, from each leader, and they will answer in the context of their city. In the interest of time, please keep your responses short and crisp, because small is always beautiful. My first question is, what are the key actions you took to sustain tobacco control, NCD prevention, and other health programs, including vaccinations for hepatitis B, in your city while responding to the pandemic? And how will you help mobilize local resources to improve these programs in future? And these include COVID-19 vaccinations. The second question is, mention just one new action, and I repeat, just one new action you intend to take in 2022 to sustain tobacco control, NCD prevention, and vaccination programs. Panelists are requested to answer these questions one by one in that order, and the questions are on the screen already for you to see, so I do not have to repeat them in the interest of time. I now request Nasruddin Joko Surjono, Head of the Regional Development Planning Board, Jakarta, Indonesia, to please answer.
Thank you, Ms. Sobha Suha, as moderator, for this opportunity. Honorable Mayor and colleagues, my name is Nasruddin Joko, Head of Development Agency, the capital city of Jakarta. Good afternoon from Jakarta. The Jakarta Capital City Government is honored for this opportunity to share our achievement and challenge related to sustainable tobacco control. There is no doubt that COVID-19 brought seismic shift to everyday life for each of us and how we operate as a global society. Their struggle, individually and collectively, to understand the virus that has set back our world. We realize that smoking is independent risk for having progression of COVID-19. The effect seems to be high among young people. Smoking prevention and cessation should remain a priority for the public policy. City is vanguard to the community, and our key action divided into three types of measure. The first is promotive measure, which is involved education and increasing awareness. This should be constantly performed, especially toward school-age children and teenagers. And some other example of promotive measures are capacity building programs, which are targeted toward health workers and teachers in relation to the implementation of non-smoking zone and consulting program to quit smoking. The second are preventive measures. This may be achieved, for example, the early detection campaign targeted at teenagers through a questionnaire and carbon monoxide detection using CO analyzer. The last one are curative measures. Among these are counseling services in assisting people to quit smoking, which are available in public health centers or through a quick line, which offer free counseling services. About our role, we are in Jakarta province established a strong legal framework as our starting point. when we make our regulation, we refer on evidence-based and also inviting academia or universities to discuss about current condition. In Jakarta's case, we stipulate regulation number 25 in this year on countermeasure against non-communicable diseases. This is vital in our effort to protect the citizen from risk factor through preventive and control effort. This preventive effort include both promotive and preventive measures such as early detection of risk factor and special protective measure. Control effort, on the other hand, include curative and rehabilitation of former smokers and palliative care. Another key step is to ban tobacco advertising, promotion, and sponsorship in all forms. In terms of integrating this measure with vaccination program and expanding the reach of both program, one of the simple ways is to deliver them through the same network of public health centers. We also have a large-scale social collaboration. It's a social collaboration program to help each other by bringing people together, whether the one who want to give and people who need help, with Jakarta provincial government as the program as facilitator. This program is expected to continue, particularly in overcoming the COVID-19 pandemic. And we also increase collaboration of various stakeholders and aim to strengthen cross-sectoral role until neighborhood level in mobilizing target and implementation vaccination, including COVID-19 vaccination. To date, just for your information, Jakarta, for vaccination issues, the first dose vaccination has been carried out for more than 11 million people, or 124% of total population of Jakarta, so almost above 100%, because 84% of population with Jakarta ID card has been vaccinated with the first dose. And the second dose of vaccination in Jakarta has been carried out for more than 9 million people, or 101% of the total population of Jakarta, covering 72% of the population with the Jakarta ID card. So the Jakarta government will continue to strive to accelerate vaccination for people who have not been vaccinated. In 2022, we have program. Still, our first aim is to increase promotional measure through social media, and also early detection of non-communicable diseases through, we call it Aku Bugar application, developed by Jakarta Capital City Government Department of Health. Another method would be forming special task force to implement smoking-free zone through local public health center and other health service facility, and increasing their scope of monitoring to assess vaccination and risk factor. And lastly, one of the most vital, given the current situation, is ensuring that every citizen of Jakarta receive the third dosage of COVID-19 vaccine in 2022, and important to encourage the stipulation of regional regulation on smoke-free areas in 2022, currently under discussion in the legislation. And then the Jakarta government implement regulation to suppress cigarette consumption by covering cigarette window at mini market with white cloth. In addition, Jakarta government has also built a smoke-free village or kampung in several locations, including Cililitan, Kayu Manis, Matraman, Kampung Penas, and other. In the future, we hope that this smoke village will be expanded in scope and have more location. And also, I would like to inform you that in 2022, a vaccination policy for children aged 6 to 11 years and third booster vaccine for the elderly and comorbid are being drafted, and Jakarta government will support this policy, especially to prevent COVID-19 cases with the Omicron variant in Jakarta. Thank you very much.
Thank you very much, sir. And I now welcome Han Kosal, Deputy Governor, Kampong Cham Province, Cambodia, to take the hot seat and answer the 2 questions, please. Over to you, sir.
Good afternoon, mayors, panelists, distinguished guests and participants. On behalf of my provincial governor, I am pleased to join with you the 6th APCAT Summit and to be one of the panelists today. For almost 2 years, the summit has been organized amidst a global health crisis of COVID-19, hampering our economy and social progress, and pulling back millions of our people on the planet into poverty. However, the crisis can never shrink the spirit of protecting our people from COVID-19, such an obstruction. The spirit of the Asia-Pacific Cities Alliance for Health and Development, instead amplifying not just our voice, but also our activities in the communities where we live. So I'd like to thank all co-chair members, especially Mayors Francis and Dr. Bima, for maintaining such an extraordinary collective spirit. The fact is that I didn't have as many choices for implementing the activities of tobacco control during the COVID-19 as I did because of social restrictions. In my province, during the COVID-19 transmission, in time when the population was not fully vaccinated and restrictions were set down, most activities were directed to public disseminations, both in community and on social media, as well as via local radios and TV stations, concerning with the tobacco effect in connection with the pandemic. With the common healthcare principle, we could also do some other activities during the pandemic transmission to keep tobacco use under control with streamlined governance mechanism from the provincial level to the commune level. Those activities mostly included the installations of billboards and banners in all public institutions, private service centers, and public places, and training on abdicating habit of smoking cigarettes coordinated by the health department. With this regard, I thank the National Center for Health Promotion of the Health Ministry Cambodia for the video clips and the tobacco effects. And I also thank WHO for a wonderful award to my administration in recognition of effort on tobacco control in my province. From the office where I'm sitting, I want to thank the Church of Jesus Christ of Latter-day Saints and the Union for the support to us, as well as shared value in this award. At this moment, Cambodia has been on the way of being cautiously reopened step by step to normal life with new living conditions based on the 4 main rationale declared by Samdech Prime Minister Hun Sen. Despite reopening the country, Samdech Prime Minister keeps calling for greater vaccination, including booster shots, and better practice of healthcare principle to avoid the health risk to COVID-19. So such a government's decision will soon provide us opportunities to pursue the activities of tobacco control to the pathway of smoke-free city. 2 weeks ago, I joined a meeting held by the Health Ministry Cambodia and discussed about the draft strategic plan 2021 to 2026 on reducing tobacco use and keeping it under better control. The plan that encourages stronger commitment and bolder actions to achieve the smoke-free city of my province by the promising year 2023. That success requires not just words and plans, but most importantly, actions. The actions like strengthening the capacity of my responsible teams and governance mechanisms to promote public awareness and enforce the law. And the actions like monitoring and evaluation, learning and sharing experience, and designing innovative programs to ensure not just the success of the provincial smoke-free city in 2023, but also the good health of the people in time ahead. And some other action like mobilizing as many resources as I can to empower the activities of tobacco control and encouraging farmers to change the farming product. These actions have been done and will be deepened over the years ahead. I will keep revising the plan of the provincial smoke-free city in adaptation with the current situation and the challenges that may come. And with the coordination of the Health Ministry Cambodia, I'm willing to extend the hands to seek further cooperation with local, national, and international partners. My administration is ready to take the move forward. Thank you so much.
Thank you, sir, for a very candid sharing of your experience and your leadership actions. Our next panelist is Dr. Kusdinar Untung Yuni Sukhowati, Mayor of Sragen District, Indonesia, to tell us about her local initiatives. Over to you, Madam.
Terima kasih, selamat sore dan
Thank you. Good afternoon, and thank you very much for the opportunity given to the Sragen district to share with you, especially with other mayors or regions. So in terms of the tobacco control in the district of Sragen, we already have bylaw number 1 of 2011. It's a local government as well as its implementing regulations. The regions regulation number 72 of 2011 on the tobacco control in the district of Sragen, especially for the smoke-free area region. In this case, the public space, the workplace, children's playground, sports facilities. These are some of the public spaces where smoking is prohibited. And this is the implementation of this regulation. It will be enforced by the bylaw police. They regularly organize raid and they would observe these places in order to ensure that these places are free from smoke, cigarette smokes. And Sragen is also one of the child-friendly cities. So we have also children's forum that help us in campaigning against tobacco. So they disseminate information to their peers in school because these children are prone to cigarette smokes. Third, we in the district of Sragen enacted a regulation to ban cigarette ads in a form of banner, billboards that are spread across Sragen district. We even tried to continue implement this down to the village level. We have 196 villages in the district of Sragen. And we need to ensure that all of the government activities are not sponsored by tobacco industry. So this is our consistency in order to maintain Sragen free from cigarette smokes. We also have a movement called Gerus or Gerakan Anyahkan Rokok untuk Sukawati. So it's like a smoking or anti-smoking movement in which everyone, any element in the society has the responsibilities to ensure that the Sragen district can enforce their bylaw. In terms of the hepatitis B, we conducted early detection of hepatitis B, screening of the pregnant women in order to know their hepatitis B status. In the district of Sragen, in the year 2021, we have 10,483 pregnant women and we filtered them. 140 were found positive with the HSAG and then we vaccinated them. We provide them with HPO, HB1G from 6 to 12 hours upon delivery. So that's our SOP in the district of Sragen. We would detect, we would perform early detection for every infant born in order to rescue the future generation. The routine immunization for infants, this is something something that we also do regularly. We need to also involve the health cater in the society to improve advocacy and technical knowledge about the hepatitis virus to everyone in the community. So we have posyandu cater, we call them as health cater. So they're were the ones who go from door to door to share information about hepatitis. Another information that I'd like to share with you, um, the coverage for the first dosage has reached 87.64%, and the second dose is 79.96%. And then this is actually remarkable. Most of the people in the Sragen, almost million people of populations, we have been vaccinating the population. In terms of the second question about what we're going to do in the district of Sragen, we would mobilize the head of the sub-districts, head of villages, down to the head of the neighborhood unit to collect data as well as to mobilize vaccination, to roll out vaccinations. Another thing that we do is that every local government unit in the district of Sragen, they are responsible for facilitating coordination. They have what we call the regional mentoring. So each local government unit is responsible to one or two villages so that the vaccination target, the COVID-19, hepatitis B, or other communicable disease vaccinations could be achieved as planned in our target. And then in terms of implementation is that all components, the civil servants in the district of Sragen are involved in the whole process. Our cadres are responsible to observe and to educate the people around their homes from their right, left, front, back, side of their home. They have responsibility to educate their neighbor. And next, last but not least, about what we're going to do for 2022, we are going to add budget allocation so that we'll be able to provide sufficient incentive for the human resources, in this case, the healthcare cadre or the posyandu cadre, so that they'll be more inspired to do more dissemination of information. And for the Puskesmas, we were going to put forward the promotive and preventive measures. Last, village fund is the most important component for us to so it's not only for the infrastructure development, but we can also utilize the fund for healthcare purpose. So these are some of the achievements in the district of Sragen. These are the best practices in our district. Hopefully, these would be modeled anywhere, and we can also share knowledge after this. We can exchange knowledge as well. Thank you. That is all from Sragen.
Thank you very much, Dr. Sukhovati, for sharing such strong actions which you are taking in your district. And they are to be emulated by others everywhere, not only in Indonesia, but elsewhere also. Thank you very much. Yes. I now request Dr. Muhammad Idris, Mayor of Depok City, Indonesia, to share his thoughts on this. The questions will be there on the screen for you, so I will not repeat them again. Over to you, Dr. Idris.
Yeah. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. I wish you all a very good health. First of all, I'd like to extend thousands and millions of gratitude for the organizing committees of this event, and thank you for all of the resource person, remarkable resource persons in this 6 APCAT, and also to Ibu Soba Sukla as the moderator for this session for the directions. Briefly, I just want to emphasize in regards to the tobacco control and other healthcare programs in the city of Depok, thanks be to God that since 2014, we've issued the local regulations on the smoke-free area zones, the bylaw number 23 of 2014, and it's been revised in 2020. And about the other programs, for instance, vaccinations of hepatitis B, we have been doing it since 2010. Until now, this program is still rolling. Thanks be to God for that. And this is actually very much in line with the theme that we have right now. It's very relevant. Together, we bring health solutions. How we can empower the community, the society, in the efforts of controlling tobacco and other healthcare measures in the city of Depok. We've empowered the community-based healthcare efforts by involving the youth through their adolescence groups, the PIC-R or the genre, in this case, the adolescents. We involve them in the whole process. For instance, in empowering the posyandu to prevent the communicable disease as well as the non-communicable disease. We also do the no smoking campaign, and then to empower the youth communities. And then in terms of the government's effort on the budgeting or allocation, since we've enacted this law together with this, and we have started to budget from the state local budget of the city of Depok with this regulation. Thanks be to God that it doesn't reduce the revenue. So we even managed to increase the revenue, and our state budget is sorry, a local budget is reaching 3 trillion rupiah. Initially, it was only 1 trillion. We also provide stimulus, financial stimulus for the society, for the community, in helping out healthcare activities in the society. And then in terms of the role of the mayor with the decree for the monitoring team, we've issued this. So we will try to empower the posyandu, and each neighborhood we have 2 or 3 posyandu. So in the year 2022, we are going to add smoking cessation clinic in the Puskesmas in district of Depok. We're going to add stimulus for the people, especially for the health family, and also early detection, especially for the risk factor of the non-communicable disease for population above 15 years old, for 1.3 million of people of Depok who are above 15 years of age. In the year 2020, we have planned to have the no smoking movement from home. This is tobacco control movement that we use a base that we use the society. So this is what we have been doing in the city of Depok. So that's why we are very thankful for all of the opportunity. I hope that this continue to happen, as well as the support from the APCAT to give us funding supports. So especially for the areas such as the ones that we have in the city of Depok. We know that the COVID-19 impact, we need to work extra hard to raise funding, especially to maintain good health campaign in the cities, just like the city of Depok and the district of Sragen. Again, I'd like to extend my highest appreciation for everyone. In terms of vaccination during pandemic, thanks be to God that we have already reached from 2,050,000 people of the population in Depok, we have reached above 80% for the first dosage of COVID-19 vaccination. The second dosage is already reaching 10% of the population. Hopefully, this will improve the healthcare of Depok City. We are still amidst the pandemic, even though we know that the city of Depok has started to show a declining trend of COVID-19 prevalence. And in terms of those who are still in the isolation or being treated in the hospital, the number is less than 100 people, 100 patients, and hopefully they will be able to recover in a good health, and then we will be able to release ourselves from the COVID-19 pandemic, especially in maintaining the tobacco control with other healthcare programs. Again, thank you very much for the support, and thank you very much for the support from everyone, including the people in Indonesia. Thank you very much. I hope that we will be able to spread this positive examples to everyone, especially for Bapak Bima Arya, who is very active in campaigning for the tobacco control or no smoking zone in his region. Thank you very much, and I wish you all a very good health.
Thank you very much. And thank you for the positive message you have generated, and may we become a COVID-19 free generation also, along with a tobacco free generation. We will now hear from Dr. Doan Tan Bu, Vice President of Dong Thap Provincial People's Committee, Vietnam, about some of the actions taken at the local level and one action which he proposes to take in 2022. Over to you, Dr. Bu.
Hai câu hỏi. Ladies and gentlemen, dear participants, every year Dong Thap Province develops and implements an action plan on public health in order to strengthen strict enforcement of the law on prevention and control and tobacco harms and a smoke-free environment at agencies and organizations. In the context of COVID-19 epidemic, activities on tobacco harm prevention are still carried out with different methods, programs, and forms to adapt the actual situation. The message given by WHO quit smoking will have reduced the risk of COVID-19 and reduce the risk of severe disease and death with COVID-19. Dong Thap Province has implemented activities including communicating people about the prevention of tobacco harms on media and internet in order to raise public awareness about the harmful effects of tobacco, organizing webinars to share experiences on tobacco harm prevention, integrate tobacco prevention content into schools curricula, and replicate the implementation of smoke-free environmental models. Maintaining community activity models to prevent tobacco harms, which is based on the Elderly Association of Dong Thap Province. Organizing communication sessions, disseminating knowledge and mobilizing people on tobacco harm prevention in communes and districts of the province. The model is funded by the Vietnam Public Health Association. This activity has been implemented since 2015 and has achieved many practical results, reducing the percentage of smoking.
In the context of the COVID-19 pandemic, the COVID-19 vaccination has been accelerating with the goal that by the end of 2021, over 95% of the population over 18 years old will receive 2 doses of vaccine in order to create herd immunity, reduce risk of hospitalization and death, and reduce the risk of severe disease in those at risk of underlying medical condition and patients who smoke. And in parallel with the fight against the COVID-19 epidemic, Dong Thap Province is implementing community health care activity to reduce pre-existing health conditions and increase the ability to cope with the multiple disease when the epidemic spreads. Specifically, one of the strategies, the development goal of the Dong Thap Province from now to Vision 2050 is to build a health city. To achieve this, leader of Dong Thap Province annually incorporate a public health program into provincial plan, strategy and resolution in the context of the COVID-19 pandemic. In order for these public health activity to be carried out in parallel with the combat against the epidemic, the provincial People's Committee established a steering committee for COVID-19 prevention and control, aiming to summarizing and assessing the situation, developing a response plan, and promptly directing vaccinations activity, management of COVID-19 patients in the community. All these public health are implemented based on the complement of the anti-pandemic principle. The province also makes the most of its human and material success, mobilize treatments of facilities such as hospitals, schools, dormitory, factory, and private company to serve the treatment. Quickly roll out vaccination. Vaccination is carried out in a mobile form to each district and commune of the province. The elderly with the vice as a vice president of the Vietnam Public Health Association, I direct you to maintain public health care model such as elderly model in the prevention of tobacco harms in the community. This model is highly valued and sustainable because of the it has enjoyed and making effort the policy making agency and especially local area, local agency and people's community. It does not require a big cost, but operate mainly based on people's voluntary willingness. In this model, the government and school only organize, guide, and change, and not directly operate, but it is directly. And regarding the questions number 2,
the goal of this activity is to increase the rate of TB detection and the collection of treatment for elimination for 2035 and progress toward TB eradication. At the same time, the activity also aims to detect respiratory disease, lung cancer, and COPD in the community. People with one of these symptoms of pulmonary tuberculosis, prolonged cough, persistent cough with sputum, coughing up blood, chest pain, mild fever in the afternoon, night sweat, unexplained weight loss, prolonged fatigue, household contact, close contact with TB patients, people aged 50 years old and over. People with chronic diseases, form of implementation, performing community PPE screening by X-ray and PCR combined with vaccination. The implementation initiative of government, school, business coordinate to implement. Thank you, the organizer and participant.
Thank you very much. And thank you very much, Dr. Bu, and thanks for bringing TB into focus and TB control actions you intend to take in 2022. Very timely and pertinent. With this, we come to
ông Bill đã đưa ra những cái.
Thank you. With this, we come to the end of the roundtable part of this session. Thank you, panelists, for your valuable inputs that reinforce the importance of local leadership in achieving global goals. I now invite Professor Tejandra Yoga Aditama, former Director General Disease Control, Ministry of Health Indonesia, and former Director Communicable Disease Control of WHO Sierra region. He will elaborate upon the One Health approach, which is so crucial to achieving all our health and development goals. Over to you, sir.
Thank you, Dr. Skula. So if I may share my screen, please.
You can share your screen from your end. I think you have the option to share.
I'm doing it. Hopefully it's already.
Yes.
Okay.
Yes.
So in the coming 7 minutes, I will discuss regarding the One Health and COVID-19. As we all know that One Health has 3 approaches. I mean, 3 in 1, you can say that. That is for human health, animal health, as well as environmental health. Sorry, I cannot make it a slideshow. Please bear with me for some seconds.
Yes.
Sorry for that. But anyway, let me just, if I can, still cannot have that. I don't know what happened. So as I mentioned, I will talk about the One Health and COVID-19. This is regarding as we all know that COVID-19 is still one of the important or one of the biggest public health problem that we have global. We have more than 2 million people already affected. I mean, 200 million. How can I get this one? Why this is not working? Can I just stop share and reshare it again?
Yes, yes, you can reshare. Or your voice is good enough for us to hear, Professor.
Yeah.
But as you please.
I'm stop sharing it now and then.
Sharing, we can help you to share.
If you have the one with you, please.
Yes, yes. We have mine to see.
I think it's better. I use that one. No, I cannot close mine. So
the PowerPoint is on now, Prof.
Chandra is freeze.
Hello, Prof. Chandra.
Who is sharing this screen? Is Professor Chandra or you, Savita?
I'm sharing.
Sorry?
I'm sharing Savita here.
Savita is sharing. Prof. Chandra is not. He was free.
I think he lost connection.
Yes, I think we have lost him.
We can.
Okay.
We can switch the order.
Can we come back to him? Yes, can we come back to him later on? So I think there is some connectivity problem at the end of Professor Aditama. So I invite Ronello Ablia, Sub-Regional Representative for Southeast Asia at World Organization for Animal Health, who will now share the tripartite One Health strategy in Asia Pacific.
Thank you, Chair, Facilitator, Dr. Shumsa. Okay, I'll share my screen. Okay, please confirm if it is on now. I'm showing the.
No, we can't see.
You can see.
No.
I think better we share, sir, from here. Yeah, that is good.
I see. Same problem with.
Yes, now we can. Now we can see something on the screen.
This is my
Okay.
screen now.
Okay, whatever. Okay.
Yeah, so I'll be discussing the implementation of the tripartite One Health strategy in the region. Next slide, please. Okay, so why One Health? Okay, 60% of emerging infectious diseases in humans have an animal origin, and majority of these are coming from wildlife, 72%. So with all this increasing interaction of human-animal health ecosystem, so we really need to have a more holistic approach in managing health problems. And this current problem we have now with COVID, it has been identified that the main source is coming from coronavirus from bats, but still to be identified what's the intermediate host before it jumps to human, which is still under investigation. Unlike the first SARS epidemic in 2003, it has been identified that it was civet cat was the intermediate host. Next slide, please. Okay, so the concept of One Health, it's a global strategy for preventing, managing, and managing risk at the human, animal, and ecosystem interface. And this has been really popularized during the time of the zoonotic influenza, the bird flu, the pathogenic influenza, which was really triggered globally the importance of preparing the next pandemic because of the 1917 pandemic, the first pandemic of flu, that it was seen that this ongoing epidemic of highly pathogenic avian influenza in Southeast Asia might cause the next pandemic. So all the countries has really adopted what we call the One Health approach during the ministerial meeting in 2008. Next slide, please. So for the OIE, we work closely with the FAO and also the WHO, and we have formed what we call the Tripartite Alliance. So we have been working together in addressing these common public health threats, and we have reaffirmed this commitment through a new MOU in 2018, and in 2020, the UNEP, the United Nations Environment Program, has joined the tripartite. So we call it now the tripartite plus UNEP. Next. So during the early days of the tripartite alliance in 2011, we agreed that for us to really show how we could work together, let us use what we call some issues and disease that we could work together to really demonstrate on how One Health approach can be applied at the global, regional, national, and at the field level. So it was agreed to use rabies, antimicrobial resistance, and zoonotic influenza. Next slide. So in Asia, as early as 2010, with this declaration coming from the global level, we started together with FAO and WHO, we started working with the Ministry of Health, Ministry of Agriculture, and Ministry of Environment. Every year, we come together to discuss how to overcome zoonosis, how to overcome, during the time, the main problem is the avian influenza, and also later on, it was the AMR, and of course, rabies. Next slide. So for specific for Southeast Asia, the tripartite has supported the 10 countries in ASEAN in developing a regional strategy. This is the ASEAN Rabies Elimination Strategy that was endorsed by the Ministry of Health and the Ministry of Agriculture in 2014. And we have provided some support for conducting mass vaccination at the ground level. Next. And also for antimicrobial resistance, since the declaration by UN to come up with a global strategy on antimicrobial resistance, the tripartite also has worked together in campaigning for the reduction of antimicrobial resistance. And the most recent one, the 2021 World Antimicrobial Awareness Week, where we conducted a massive information campaign to reach out as many stakeholders as possible to be aware on the importance of antimicrobial resistance. Next. And the OIE, and also, of course, together also with our partners, we are working hard really to reach out in looking at the, as I presented in the first slide, on the importance of wildlife in this transmission of diseases coming from wildlife going to the domestic or human. So we have launched in 2015 the OIE Wildlife Health Framework to build, to strengthen the strategy of the veterinary service, the animal health sector, in conducting surveillance, strengthening its surveillance, and mitigating the risk of wildlife diseases, particularly those with zoonotic importance. Next slide. And together with WHO, we see that that in order to really prevent this future pandemic for the animal health sector and for the human health sector to be able to mitigate any future pandemic, we really need to build resilient health systems. And when we say health system, it composed of the animal health systems and also at the public health systems. And we have this program on OIE PBS, or the performance of veterinary services, and from the WHO is the IHR, or the International Health Regulation, and including the joint external evaluation together with the IHR, GEE, and the OIE PBS. We are working together to identify what are the gaps at the country level and develop and develop a roadmap in order to overcome these gaps to build in strengthening health systems for both public health and the animal health systems. Next slide. So in conclusion, to stop future pandemics, we really need to focus at the animal source, where the risk is coming from of all these future pandemics. And for us to, we need to strengthen multi-sectoral collaboration, and it is essential in addressing complex health threats. And the local government, and I really appreciate, for me, this is the first time that I have attended this summit of mayors. I really appreciate this network of mayors in Asia and the Pacific, because the mayors are the one on the ground, and you play a very significant role for the success of One Health in the implementation on the ground. The OIE, FAO, and WHO, we have been working with national government. This is the first time I'm talking to the mayors who are working on the ground, and I really appreciate all the efforts that you are working for the control of tobacco and all the other neglected zoonosis. And hopefully, we could also reach out on the implementation of One Health approach to prevent future pandemics at the ground level. Health systems strengthening both in human and animal health are critical to prevent and control future pandemics. Thank you.
Thank you very much, Ronello, and for emphasizing also that plant and animal health is as important as human health. And for us humans to remain healthy, we cannot ignore the other two. Thank you very much for your presentation. And now invite Professor Aditama once again. I think he's back. Yes, over to you, sir.
Thank you. So sorry for the technological glitch. So as I mentioned earlier, that my task is to discuss COVID-19 and One Health, and Dr. Abila already explained to us what is the concept of One Health, of the animal health, human health, and environmental health. But now we are talking directly related to COVID. Could I have the next slide, please? As we all know that COVID is still a public health important problem, not only public health, but even economical and political aspects. So as of, I have a new slide of 6 December anyway, so it's about more than 260 million people confirmed cases around the world, with more than 5 million deaths already reported. Fortunately, we have more than 7 million vaccine doses have been given, even though we all know there is uneven or inequity between country to country and region to region that receive a vaccine, with all of the impact of this inequity or inequality of vaccine given globally. Next slide, please. And the above figure showing the epidemiological trend globally. So we see there are already 3 waves for this COVID-19 so far. The first wave, second wave, and third wave. And now looks like it's going to be a 4th wave, because number of cases are increasing again globally. But below, on the left, you can see the Southeast Asia region of WHO. As you know, we in Asia Pacific kind of divided into 2 regions by WHO. Some belong to the Southeast Asia region of WHO, some belong to the Western Pacific region of WHO. So in the Southeast Asia, those are the epidemiological trend, the blue or the violet graph. You can see as of now, number of cases are still under control, but in the Western Pacific, looks like there's a little bit increase, but we will see in the coming weeks or days. Hopefully, the situation in general could be better, even though now there is not a lot of discussion about this new variant of Omicron. The next slide, please. The importance of One Health and COVID-19 is very obvious. I just quote this from the CDC website that updated November 3. So the health threat, by recognizing the interconnection between people, animals, and environment, is very important. And this approach is more important than ever as we navigate through the COVID-19 pandemic. So this is very important for the COVID-19 pandemic as well as a future pandemic, which I will discuss later on. Next slide, please. These are the more than 400 animals from 29 countries that have been reported at least infected by COVID-19. You can see in the map here, and some are in the Asia Pacific region. As the next slide show, that these are some report from several of Asian countries, from Hong Kong, from Thailand, Myanmar, Indonesia, as well as Japan, about the cat, dog, and tiger. Next slide, please. I just quote some of the journals that published a kind of interrelation between COVID-19 and One Health. The one on the left below, that was last year, talking about what is the role of One Health in COVID-19 pandemic. On the left up is talking about action, so a response. What will be the reflecting on One Health action during the COVID-19 response? And in the middle, we can see the One Health disparities and COVID-19. The one on the right below is kind of systematic literature review on One Health in the context of coronavirus outbreak. It covered quite a number of literature review, and the one right up is even unpacking the COVID-19 and connection between ecosystem of animal, human health, as well as security. So it's quite a wide range of discussion about One Health and COVID-19 in this regard. Next slide, please. Next slide. Okay, so Dr. Abila already talking about the tripartite in the, so before this one, the tripartite discussion in our region, if I can get the one before this one. So actually it's already, the discussion about tripartite is already began from before COVID-19, but the one above was my colleague from WHO CRO at the time published this in the journal regarding the operationalization of One Health and tripartite collaboration in Asia Pacific region. And I think that is 2020 publication, but again, the COVID-19 the drive for One Health approach to tackle preventable illness of animal-human ecosystem in our region. So it makes this COVID-19, we can say, make it a stronger together collaboration between FAO, OIE, and WHO, which commit to joint multi-sectoral effort in Asia and the Pacific region. And next slide, we can see the head of the international agency, FAO, OIE, as well as WHO, CRO, as well as WHO, WIPRO. They are signing this collaboration to tackle preventable illness of the animal-human ecosystem. And it is clearly mentioned in the next slide what will be the real activities. So it is mentioned that as COVID-19 continues to inflict illness and misery across the Asia-Pacific region, these three international organizations, FAO, OIE, and WHO, collaborate to intensify their joint effort. Dr. Abila already mentioned that in global level, UNEP is also on board. So it's to respond to all health threats, not only COVID-19, but also zoonotic influenza, rabies, antimicrobial resistance, as well as food safety. Next slide, please. So this is just one example of the AMR that is already mentioned by Dr. Abila, the meeting of 20 to 30 September 2021 of the AMR. So as I put it on the red box below, to advocate the role of human health, animal health, food safety, and environment sector in the containment of AMR using One Health approach. Food safety is, of course, very important. Next slide, please. We know that our region of Asia Pacific have a highly diverse food culture and production system. So food safety is really important issue in our region. So the tripartite of FAO, OIE, and WHO working closely for COVID-19, for AMR, and as well as food safety. Next slide, please. So I have already 6 minutes, 57 seconds. For just 2 more slides regarding the future pandemic. So this is WHO DG, Dr. Tedros mentioning to strengthen One Health approach to prevent future pandemic. Next slide. And on the left, you can see the kind of publication talking about preventing future pandemic. Start with recognizing the link between human and animal health. And on the right is clearly mentioned not only a concept, but how this One Health become one of the pillar for a transformative of pandemic treaty. We all know that now there is a discussion of pandemic treaty or kind of pandemic convention. So One Health will be an important pillar of this pandemic, the new pandemic treaty. The last slide, please. So we have already discussed the concept of One Health related into COVID as in the above part of the slide, and we already have the regional tripartite coordination for taking care of all of the One Health issue. On the below, I just put information regarding Indonesia will be the presidency of G20. So presidency of G20 next year will be in this region. Actually began the 1st of December. And before this one, on September or October, the G20 Minister of Health already reaffirmed the need to address global health under One Health approach. So in Indonesia, might be AMR will be also on board. So One Health COVID-19 is quite an important topic for the G20 as well. Thank you very much.
Thank you very much, Professor Aditama. And thanks for your insight on the One Health, especially in the context of COVID-19 pandemic. That has once again shown us the necessity of a tripartite approach, and also for focusing on antimicrobial resistance, which is so very important to control it if we need to have a healthy society. With this, we come to the close of this very vibrant session 3. My sincere thanks to all the speakers and panelists for their valuable inputs. And I now hand over the mic to Dr. Ayu Swandevi to carry on with today's program.
Thank you, Soba. Yeah, thank you so much for warmly moderating this session, and also thank you for all speakers, panel of experts, mayors, and regions that have shared their experiences. And dear all leaders, ladies and gentlemen, it has been a very fruitful and enriching session that we have from the morning. And thank you so much for your kind of participation and interaction on all of the session, and it is very much appreciated. We are really sorry there's no question and answer session because of the time. And it is now the time of our last session, which will conclude our today's summit. For the first one, I would like to invite Dr. Subuh, advisor to Ministry of Health Indonesia, and also the head of Indonesian Health Officers Association, to give his closing remark and also vote of thanks. To Dr. Subuh, it is over to you.
Thank you, Ayu. Assalamualaikum warahmatullahi wabarakatuh.
May peace be upon us all.
In this meeting. It's pleasure for us today. We hear and discuss issues that are an important agenda for public health. As we know, the COVID-19 pandemic shows the impact of high comorbidities in COVID-19 patients, which leads to high deaths. All of these diseases have the same risk factor. This is namely smoking. So for the data in Indonesia, smoking also contributes to more than 235,000 deaths each year. It's very huge, and it's a risk factor for COVID-19. For the National Statistic Bureau in Indonesia, we know that low-income households spend more money on cigarettes than on food with nutritional requirements. Today, we have listened to leaders from various cities in the Asia Pacific, sharing tips and breakthroughs to bring health, prevent citizens from the impact of smoking, high comorbidities, and the threat of COVID-19. So we have to thank and appreciate to all leaders for sharing very useful today. Thanks to first to Minister of Health Republic of Indonesia, APCAT chair and co-chair, APCAT members, mayors, and subnational leaders. Yes. Can you help my? Yes.
We can hear you.
We can hear you. We can hear you, Pak. Please continue.
APCAT members, mayors, and subnational leaders from 78 cities of the 20 countries, Bangladesh, Cambodia, Indonesia, India, Laos, PDR, Malaysia, Myanmar, Nepal, Philippines, Singapore, Timor-Leste, and Vietnam, in all Asia Pacific. All governor and mayor who present today. International Union Against Tuberculosis and Lung Diseases, the Union, France, and Asia Pacific. UN Interagency Task Force for NCDs and Global Coordination Mechanism on NCDs, World Health Organization. Also, Bloomberg, Philanthropies USA, Tobacco Free Generation International, Head of Health Subnational Health Authorities, DINCUS, and Governance Planning Board, BAPDA, who present and attends to this event. Especially for Professor Chandra Yoga, my senior, former DG, Disease Control MOH, and also Ronelio Abela, OIE Subregional Representative for Communicable Disease and Control, WHO Shiaro. And also all participants who patiently joined in the meeting. We apologize if the implementation of APCAT activities, we have more of show the experience of the countries. This is very good. The meeting is very useful for reinforcing commitment, strengthening commitment, build accountability, increasing accountability for program implementation in the field, and ensure sustainability for especially ensuring future sustainability. The last, we hope this meeting to increase the commitment in controlling tobacco consumption for mission to action. Not only mission vision, but action is very important. I thank you. Congratulations for all speakers and participants. Thank you.
Thank you, Dr. Subu, for your thoughtful and sincere appreciation and remarks. And now, last but not the least, I would like to invite Dr. Tara Singbam, the Director of the Union Asia Pacific, who will present the key summaries of the summit and our step forward. Dr. Tara, over to you.
Thank you, Dr. Ayu. Thank you, Dr. Subu, for your great remarks. And honorable ministers, governors, vice governors, mayors, our donor and partners, civil society organizations, youth, and many academicians, the media, ladies and gentlemen. It is indeed a great honor for all of us to express our appreciation for your great participation and guidance in improving public health program in our community. It is truly realized that together we bring health solutions. The 6th APCAT Summit highlighted the 3 key priority issues as just Dr. Subu highlighted. The number 1, it reinforced the leaders' commitments to prioritize the prevention of tobacco use, control of non-communicable disease, and improvement of vaccinations in strategic and operational planning and in policy, fiscal, and legislative instruments. The second, it builds the accountability of our mayors, governors, and the ministries' leaders to protect the development and implementation of public health policies from the undue influence of unhealthy commodity industries and to ensure public-private partnership in monitoring program performance and the effectiveness. The third, the APCAT, also the summit, ensured mayors' role to invest in and sustain local health system capacity, ensure a whole of government approach for tobacco control, vaccination, and non-communicable disease. And it also highlighted the key issue by sharing the local evidence, the innovations, lessons learned, and countermeasures to improve the program outcomes in the future. Distinguished ladies and gentlemen, APCAT is a unique regional alliance that was established in 2016 with 12 cities. Now it has been expanded to 78 cities in the regions. And it works collectively in creating and maintaining the cross-sector alliance or networks it fosters the partnership both in public and private sectors, and it breeds the subnational and national public health politics and the policies and implementing health interventions and sharing lessons learned. The 6th APCAT Summit engaged. It's a really great pleasure to inform all of you that over 1,000 participants from over 130 cities of the more than 20 countries. We are encouraged with this great participation and engagement to scale up our activities with the value that no one left behind. In 2022, the APCAT prioritized the intervention as below. Number 1, tobacco control. The APCATs continue to work and with the local and national governments and advocate for effective implementation of tobacco control program that includes smoke-free environments, ban tobacco advertising and promotions, and also build the policy advocacy at the national level to increase the size of pictorial health warning with plain packaging, and also implementation of cessation program within the primary healthcare system. It also works to advocate with the governments to ban the e-cigarettes, heated tobacco products, and also raise the tax and prices on the tobacco products. The second, the APCAT will continue to work on the non-communicable disease and lung health, especially on the TB control programs. So APCAT role is to advocate local governments to ensure the implementation of TB control and NCDs by engaging the people living with NCDs and also tuberculosis, as well as the civil society on the ground. The third, and this is very important aspect, the APCAT will continue to advocate the national governments to prevent the industry interference and the rejecting the funding, logistic, donation, or grants from and the partnership with any entity related to any unhealthy commodities, such as, but not limited to tobacco, alcohol, sugary, and sweetened beverages. The fourth, we will also work on the elimination of viral hepatitis. As earlier you have heard from the Dr. Wang Cheng, that we will continue to work with the mayors as the subnational leader to scale up the elimination program of viral hepatitis to prevent mother-to-child transmission. Last but not the least, the evidence is one of the powerful weapons. So the APCAT, in partnership with the different universities and academicians, will continue to generate and share the local evidence to the mayors and to guide decision-making process and actions that improves public health systems through the One Health and the Partnership for Healthy City approach. Distinguished delegates, the APCAT Secretariat, which is based in Singapore, will ensure for effective implementation of all interventions, as I mentioned earlier, and also as mentioned by Dr. Subbu, by offering our technical assistance, our building our partnerships, measuring the impact, and sharing lessons learned and best practices. To conclude, on behalf of the Union and the APCAT, as well as the ADINCAS and many other organizers, we would like to extend our sincere gratitude to all of you for your active engagements and support. My thanks go to the APCAT media, the Union team, the ADINCAS team, WHO, OIE, the Hepatitis Fund, Vital Strategy, Bloomberg Philanthropies, Ministry of Health, from all the participating countries, civil society organizations, the youth, their leaders, universities, and all of you. So wish you all the best. Thank you very much.
Thank you, Dr. Tara, for providing the highlight of APCAT Summit and priority issues and also future direction for the APCAT and Asia Pacific health improvement. And with the remark from Dr. Tara, it marks the completion of the 2021 Asia Pacific Mayor of Summit, Summit of Mayors, sorry. And I would like to ask the participants to please check the chat box for the press notes and also APCAT Summit Declaration for your reference. And also please visit the YouTube channel of APCAT for more videos and lessons learned from different cities. And at the last time, I would like to pass my gratitude for all leaders, Mayor Garcia, Dr. Bima Arya, and also the other mayors and regions, panel of experts, and also thank you to all participants for your kind attendance and contribution throughout the meeting. I would also like to thank all institutions that involved in the organizing the event, and huge thanks to all committee members for their hard work. On behalf of the organizing committee, I would like to pass my apologies. Please accept our apologies for the shortcoming of the event. And we will see you all next year on the 2022 APCAT Summit. Thank you. Good afternoon. May all of you will always have good health. Thank you, everyone.
Thank you. Thank you.
Thank you. Thank you, Mayor Garcia, for attending until the end.
Thank you. Thank you, everyone.
Thank you, Dr. Ko.
Thank you all.
Thank you all. Thank you, everyone.
Congratulations.
Thank you.
Thank you
Thank you,
semuanya.
everyone.
Thank
you.
Congratulations from Jakarta.
Coba. Thank you, Mbak Rita.
Thank you, thank you, thank you.
Foto bersama dong, foto bersama.
Iya. Ya, boleh. Ada yang mau lead? Please open your
Camera.
The videos on cam. And this is the first slide. Jadi, 1, 2. Okay. And then next one. 8. 10. Kavita. Up. Okay, I paste the next. Yeah.
Makasih.
I got the slide. Next one. Yeah, 1, 2, 3.
Only 284.
Terima kasih semua. Thank you, everyone.
Makasih
Thank you semuanya.
Terima kasih Bu Ayu. Selamat siang.
Terima kasih, Santi.
Ya, selamat siang Bu Ayu.
Ya, Bu Santi ketemu lagi.
Iya.